Shall you start? Yeah.
Yeah.
Here now.
Yeah. She's just giving the signal. Give me 1 second. Yes. Started live. So, Julie.
So you need to unmute. Julie need to be unmute, please.
Okay.
Yeah.
Namaskar. Mo Julie Samantray, Michigan, USA ru. Samasthinku Orissa Society of America au Orissa Society of Health and Wellness Group tarafru hardika swagata. Ajira seminar ku ame start kariba. Au gata 2 mas hela ame a weekly seminar ayojita karichu au COVID-19 related topics upare. A seminar re jogo dothua speakers hele or India au international doctors. Amara udeshya hochi apan manku general information about COVID-19 related topics au guidance provide karyaku. And that's the reason amara disclaimer ta achi je ame apanku essentially chesta karuchu information provide karyaku au guidance dabaku. किंतु आपण निजर ट्रीटमेंट रिलेटेड सबु कंसर्न्स निश्चय निजर डाक्टर संगे परामर्श करिवे. विथ दिस आगो को बढ़ेवा प्रोग्राम मु एबे वेलकम करूची डॉक्टर देवाशीष राय जने एमिनेंट मेडिसिन स्पेशलिस्ट यूएसए रु आउ आमा ओरिसा सोसाइटी ऑफ अमेरिका हेल्थ वेलनेस ग्रुप रो चेयरमैन डॉक्टर राय.
Thank you, Julie. And that was a wonderful introduction. I welcome everybody around the globe and all the audience who are here to listen. And this is the 8th session we are having every Saturday. And as we promised to the Oriya community, we'll be standing by you during this time of crisis to answer all your questions and answers. Saying this, I thank all of you for supporting us and coming and joining and live and as well as through YouTube. And we have wonderful views with a lot of questions and answers. Apraman jante abhi ka jo situation rahe, India and the whole world is gripped with the fear of possible third wave, Delta plus variant. A doro and fear has spread across. We have decided to present this topic today. This topic, we are trying to focus 3 things. One is, what is this third wave Delta plus? To educate ourselves and be aware. To alleviate our fear of anxiety, stress. Number 2 is, follow the advice and do what the experts recommend. Number 3 is, which is very, very important, is surrender to the Lord and pray. And prayers have the ultimate power. So saying this, I would like to welcome our chief guest, Professor D.N. Rath, who is head of the department in PGI Chandigarh, an expert in virology and COVID. Dr. Ajit Kail, our bariatric anesthesiologist from London, UK. And Dr. Samendra Mishra, a public health expert in New Delhi, along with a core group of panel experts and our global ambassador, Sabyasachi Mishra and Archita Sao. Next slide, please. Okay, saying this, I would like to welcome Archita Sao, our global ambassador, Odia movie superstar. She's a social worker, UNICEF ambassador. And Archita, please take it from here. Thank you.
समस्तंको नमस्कार. प्रति शनिवार भली ए शनिवार मध्य हमरो एक्सपर्ट डॉक्टर्स माने एबे आसी सारछथि लाइव आपण समस्तंको क्वेश्चन रो आंसर दबा पाए. So I'm extremely thankful to all the doctors of OSA Health and Wellness Group, India, जोटा कि ओडिशा डॉक्टर्स इंटरनेशनल एसोसिएशन. सो समस्त को बहुत बहुत धन्यवाद. समस्त आज जॉइन करिसंती. आज अनेक गुडे प्रश्न उत्तर रखिबा पई. ए कोविड रो प्रथम वेव आ ए वेव रे आमे बहुत जन को हरै छै. बॉडी माने भी अछनी जो मन को पई कि हम सबले सल्यूट करि छै, तांको पई कि हम डेडिकेट करि छै. किंतु एमिति अनेक जन अछंती माने परदा पछरे रहि जाउतबा से माने भी जणे जणे हीरो से माने होचंदी कोविड रे हरैथिबा व्यक्ति मानक घरर सेही महिला माने काहेकि ना जेतेबेले घरर गोटे मेरुदंडटी भांगी जाए बा जेतेबेले घरर छातटी चली से घरर महिला को जेतेबेले घरटा चलेबाको हुए जेतेबेले कहार कोटी छोटो पिलाटी अछि कि कहार केही नाहंती तो सेमानको पई जे केते कष्ट हे जाए ए जीवन कोविड अनेक जीवन भी नष्ट करके जाउछे तेणु से महिला से मानक स्पेशली माने मु कहबी जे अपन माने के धैर्य हरा होंतु नहीं एमती गोटे समय तो केही भी भाबी नथले मो लाइफ रे आसीबो जदी आसीची जदी माने भगवान आम मान को चूज करिसेंती जे हमें सफर करबा मे बी सबुर पछरे किछ ना किछ उद्देश्य थाए सो लेट अस नॉट गो इनटू दैट एंगल किंतु गोटे माने किछटा लाइंस कहि कि अपन मानकर माने हौसला को टिके बढ़ेवा को चाहिबी शांताकारं भुजगशयनं पद्मनाभं सुरेशं विश्वधरं गगन सदृशं मेघनावरं शुभंगम लक्ष्मीकान्तं कमलनयनं योगीवीर ध्यानागयं वंदे विष्णु भाव भभयहरं सर्वलोकैकनाथम् आपण माने केही भी धैर्य हरा होंतु नहीं जदि एई समय गोटे कठिन समय हम पाखरे आसीची आमे माने धैर्य हरा नहि कि आपको फेस करबा हम लाइफ को आगो को बढ़ेई नबा आ जदि भी आपण आख पाखरे केही भी एई भली महिला माने अछंदी जो माने आपनकर सपोर्ट चाहउछंदी मेंटल सपोर्ट चाहउछंदी किछि भी जदि न करि पाछंदी खाली तांक साथे ठीक कथा होंतु तांकर हौसला बढ़ंतु जेते बळे किछि ना किछि हेल्प आवश्यकता रहि जे सबले समान साथे छिडा होंतु सो विथ दिस लेट अस कंटिन्यू आज सेशन को आगो को बढ़ेबा
नमस्कार मु डॉक्टर संगीता प्रधान मिशिगन रो प्रति शनिवार भले आज पुणी आम मिसिछे प्रति शनिवार भले पुणी आमर सीनियर मेंबर आमर मेंटर डॉक्टर अग्रवाल डॉक्टर नानक राम अग्रवाल तांको इनवाइट करिबी प्रेयर रो स्टार्ट करिबा पई तापरे पुणी आम डिटेल्स को जिबा नानक भाई
Dear brothers and sisters, Namaskar. Let us pray to Ma Durga. Om Sarva Mangala Mangalye Shive Savartha Sadike Sharnaye Trayambake Gauri Narayanini Namostute. Om Sarve Swarape Sarvashe Sarva Shakti Samanvite Bhaive Traino Devi Durge Devi Namostute. We bow to you, O Devi Narayani. Next slide. You are the auspicious for everyone. You bring happiness. You are the one who completes every work for everyone. You are protector of everyone. You are the one with 3 eyes and a beautiful face. We salute you, O Narayani. You are present everywhere, omnipresent. You are the power in everyone and in everything. You eliminate fear. We bow to you, O Devi Durga. Next slide, please. In all religions of the world, it is emphasized that service, seva, or duty triumphs all the time. Furthermore, Swami Sri Sri Ravi Shankarji further states that if you are doing seva, you will have no dearth. Whatever is needed will come to you when you need it. So my appeal to every one of us is that please don't sit back, but please wake up and help in whatever capacity you can. We will win. Thank you all. Now it is my privilege and honor to request my younger sister, Dr. Sangeeta Pradhan, to take over. Thank you.
Thank you, Nanak Bhai. This prayer really gives us strength to sustain all this that we are going through. So, ebe jemti gita re achi gyana kanda, karma kanda, ame ebe amaro karma bisare kahiba. At the same time, next step ko jiba gyana. So, eta amaro project samaste jani chanti. आमे हेल्प करबा को हमरो प्रतिटी चेष्टा रही। रश्मि नेक्स्ट स्लाइड को जीवा। सो एटा होची हमरो जो अमृतधारा सेंटर स्टार्ट हेची ऑक्सीजन शेल्टर सेटा भुवनेश्वर रे तार काम से चललानी एबे बहुत भल रे चलची एंड गिव्स अस लॉट ऑफ सैटिस्फैक्शन ए सब काम देखिबा पे। सो आमे सब प्रोजेक्ट हमर जहां चलची आज आपन को देखेबू। एटा होची फूड डिस्ट्रीब्यूशन शेल्टर हमर गोटे कंबाइन करछु हमें वॉलंटियर ड्राइव एटा जो थरे की वैक्सीनेशन संगरे भी कंबाइन करा होची आ वैक्सीनेशन नेले ता संगरे हमें फूड भी डिस्ट्रीब्यूट करछु। सेटा गोटे एनकरेजमेंट जे आपन माने वैक्सीन नियंतु बिकॉज़ सेटा ओनली वे जोटा कि हमें समस्त मिसी की स्ट्रांग है कि वी कैन फाइट दिस कोविड। द भुवनेश्वर फूड डिस्ट्रीब्यूशन सेंटर एटा होची टिटलागढ़ रे वेस्टर्न ओडिसा रे टिटलागढ़ रे लायंस क्लब संगरे कोलैबोरेट करिकरी काम चलची। एटा आ गोटे हमर फूड डिस्ट्रीब्यूशन शेल्टर बहुत भलो चलीची। वैक्सीनेशन सेठी 250 लोकन को दिया हला गोटे दिन रे। सो जस्ट तांको एजुकेट करा होची वैल्यू बुझा होची वैक्सीनेशन रो तेनो ए काम भी चलची पैरेलली मल्टीपल जगह रे सब चलची। एटा होची बरहमपुर रे रोटरी क्लब संगरे कोलैबोरेट करकी करा हेची सिमिलर काम। हमरो गोल हैला मैक्सिमम लोको केमती भलरे रहिबे। टिके म्यूट करिवे समस्ते केमती हेल्प करि परिबा हमें समस्तन को। आउ एबे भी हमरो फंड रेजिंग एफर्ट्स चलची काना ए काम तो आरंभ होईची ये सरी बनी। एटा हमरो लायंस क्लब कटक संगरे कटक एससीबी मेडिकल कॉलेज रे हेथिला सोमु भाई को मेमोरी रे जे देवाशीष भाई को साना भाई तांको मेमोरी रे हेथिला फूड डिस्ट्रीब्यूशन। सिमिलर एफर्ट्स फूड डिस्ट्रीब्यूशन चलची वीडियो रे अपन देखि परिबे। पीपल आर टेकिंग नेसेसरी प्रिकॉशन मास्क पिनचंती समस्ते। एटा होची आउ गोटे एस्पेक्ट हमरो एटा होची पोस्ट कोविड परे एटा गोटे वेलनेस सेंटर बरहमपुर रे रोटरी क्लब संगरे से माने एठी आपण देखि पारुचंती एक्सरसाइज करचंती प्राणायाम योगा सब करा होची टू हेल्प विथ देयर हीलिंग फास्टर सो दे कैन गेट बैक टू नॉर्मल लाइफ एज सुन जते शीघ्र पहुंची परिबे। एटा आउ गोटे वैक्सीनेशन ड्राइव ग्रोसरी पैकेट दिया होची वैक्सीन नेला परे सेटा दिया होची जस्ट गोटे एनकरेजमेंट लोकन को। आपण माने देखिले आमे सब केमती काम करूछु स्टार्ट करिथिलु आमे गोटे छोटो प्रोजेक्ट रु एबे एटा एते बड़ ही गलानी आमे डिफरेंट सेंटर्स आगु को खोलिवार भी बहुत हमरो इच्छा। भगवान करंतु आपण माने एमती सपोर्ट करू थांतु। आ जदी आपण कंट्रीब्यूट करचंती बहुत बहुत धन्यवाद। आ जदी करि नहंती प्लीज कंसीडर डोनेट करिया पई आपण देखुचंती इट इज बीइंग प्रॉपर्ली यूटिलाइज्ड प्रॉपर्ली चैनलाइज्ड एंड आमे सब वीक रे आपण को अपडेट आनी कि दबु केमती सब काम चली छी। सो एटा होची हमर लिंक डोनेशन पई। नाउ एट दिस स्टेज आई वुड वेलकम Dr. Athusu Naik, intervention cardiologist from Houston, to take over and proceed forward with the meeting today.
Thank you, Sangeeta. Namaskar. Good afternoon, good evening, everybody. So, ବର୍ତ୍ତମାନ ଆମେ ଆମର आज मेन टॉपिक डिस्कशन आरंभ करिबा। आज जो टॉपिक ऑलरेडी आमे कहि सारिछु टॉपिक होची कोविड म्यूटेंट वायरस लाइक डेल्टा वायरस डेल्टा प्लस and is there any potential for third wave in India? Aji ame very fortunate we have three world famous doctor aji panel join करचंती semane a different topic विषय aji discussion करिवे। और प्रथम panelist हेले Dr. Radhakant Ratha. Dr. Radhakant Ratha currently he is the professor and head of the department in Postgraduate Institute of Medical Research, Chandigarh, Achanti. She joined कले 2005 as a head of the department. Actually, she microbiology post graduation college in 1989 in PGI, and he also diplomat in microbiology and in 1991 in India. One of the authority, one of the world famous renowned virologist, and he has published more than 100 articles in different journals. Recently, tanku bahut award milchi. Recently, he got an award called S.C. Agarwal Oration Award in a annual conference in Indian Association of मेडिकल माइक्रोबायोलॉजिस्ट ये जो अवार्ड बहुत कम लोगों को मिले and he got it because of his research on diagnosis and immunopathogenesis of dengue virus, chikungunya virus, Zika virus, hepatitis virus, H1N1 flu virus. He is one of the authority in all the viral diseases, including Delta virus and Delta plus. So we are very, very fortunate कि से तांको busy time रू, busy schedule रू आज हम panel join करचंती. Without any further ado, I'm going to request Dr. Rathak, please go ahead. Please enlighten us on the topic Delta virus and Delta plus and different mutants of COVID virus. Dr. Rathak, please.
हेलो नमस्कार गुड इवनिंग टू ऑल जेते सब आमर ओडिया भाई अछंती भारतवासी प्लस प्रवासी ओडिया जेते सब अछंती समस्त मोर प्रणाम आज एक सुजोग मिलची जे मो प्रथम थर पई एते बड़ गोटे संस्था विदेश रो काम करची आम देश पई हमर राज्य पई हम उत्कल वासी सेटा मो आगु जानी पार नथि मोर सेटा बोधे जानवर कमजोर रही था किंतु आज जहाँ देखिली रियली कहते ना गोटे एनकरेजमेंट आ उत्साह जागृत होची जे एमती काम करबा भी बहुत इम्पोर्टेंट हवा दरकार आ मो आज संध्या रे समस्त धन्यवाद दूची स्पेशली डॉक्टर आतुष नायक जे एते विषय मो विषय कहीदेले जो मुझे न होते पारे किंतु भल लगिला शुणिकी आ खुशी लगिला तो मु भी आपन संगे आगु को जोड़िया पे चेष्टा करी डॉक्टर देवाशीष रे चेयरमैन ओडिया सोसाइटी ऑफ अमेरिका हेल्थ एंड वेलनेस ग्रुप बहुत दिन से इंटरेक्ट करके से जो उत्साह जागृति करे मो मन रे से मो बहुत बहुत धन्यवाद डॉक्टर बसंत महापात्र भी से बहुत किसी रही प्लस मोर को स्पीकर डॉक्टर अजित कायल जे कि मोर सांग आ सहकर्मी पीजीआई रे हमें बहुत वर्ष सांगरे रहिथिलु बहुत खुशी लागिला से एथिरे जोड़चंती आ तांको जरिया रे ही मु आपन मान पाखु पहुंच पारली सेटा होची मोर सौभाग्य कहले चले खुशी र कथा वर्तमान समय अधिका नष्ट न करके आम सुनिच कार्य जीवा जहाँ गोटे एजुकेशन पॉइंट ऑफ व्यू रे एते सुंदर कार्यक्रम आपन माने करचंती सेटा मोर बहुत भल लागला जहाँ किसी भी कंट्रीब्यूट कर पारबी सेटा मु चेष्टा करबी आ हमर जो वायरस लैंग्वेज ता टिके कॉम्प्लिकेटेड थाए एज सच कारण गोटे तो जीवाणु सेतरे विषाणु सेतरे भूताणु भूतर पुणी पेट भीतर पसिकी सेतरे तार जेनेटिक मटेरियल बाहर करके ताको पुणी स्टडी करी ता विषय रे जहाँ किछि व्याख्या करिवा समस्त पक्ष टिके कष्टकर फील हुए तो मु चेष्टा करी कि जेतिकी दूर लोक पाखु पहुँच पारि जहाँ किछि जानी सेटा मोर चेष्टा प्रचेष्टा रहिबो मते जो टॉपिक टा दिया से टॉपिक टा होची कोविड-19 वेरिएंट रे पुणी आउथरे वेराइटी से भी गोटे डेल्टा वेराइटी तापर पुणी डेल्टा प्लस तार क्लिनिकल सिग्निफिकेंस मु बहुत किछि 15 मिनिट समय भीतर न कवर करि पारे किंतु चेष्टा करछि टिके टच करिया पई जे जिंस कोन माने बेसिकली हम जानिया दरकार छी जिंस कोन स्लाइड्स टिके फास्ट स्लाइड ही परियो दी नहीं फर्स्ट बिगिनिंग beginning slide. Yes. So या कहवा चाहूली जे कोरोना वायरस भली बहुत बहुत किसी वायरल इन्फेक्शन अच्छी. नेक्स्ट प्लीज. वायरल इन्फेक्शन जोटा कि आम बहुत समय मिस कर जाऊ हम जानी पारुनी कारण सेल्फ लिमिटिंग टाइप डिजीज एटा एमती एमती एग्जांपल थिला जेतो H1N1 आस्तिला से समय भी एमती रेस्पिरेटरी इन्फेक्शन होतिला आ लोक चलथिले कि लास्ट डे मार्च 29 तारिख रे 2009 मार्च 29 तारिख दिन से गोटे केस को उठेथिला मेक्सिको से जो टाइपिंग कर पारे से WHO पठे CDC पठे से सेठू जाई कहले जे ये गोटे भाइरस जोटा इन्फ्लुएंजा नुआ टाइप. तो इन्फ्लुएंजा नुआ टाइप सुनिबा मात्रे समस्त मन जो उत्साह जागृति हैला तापरे गोटे गोटे केस ऐड हे लास्ट को 2009 रे H1N1 गोटे पैंडेमिक डिक्लेरेशन हैला जून रे सेम टाइप रो जिंस आज आसी आउथे पहुंची 2009 परे 2019 रे 10 वर्ष पर आउ गोटे पैंडेमिक माने प्रति डिकेड रे आमे गोटे वायरल पैंडेमिक को देखुचे से सिनारियो को हमको आगु को रखियो पियो आखि आगे जे जते भी जहां भी हले हमर प्रिपेयर्डनेस सेते दूर पण रहबा दरकार जाकि हम पैंडेमिक होबा पे ना तो ये जो डिजीज आरंभ हैला ये भी गोटे अनयूजुअल निमोनिया फॉर्म रे 2019 रे डिसेंबर 8 तारिख को केस गोटे डिक्लेयर हेतला वुहान सिटी रे जोटा जनवरी 11 बेलू से जाकि 41 नंबर पहुंचला आ से जो वुहान सिटी रो हेल्थ कमिश्नर से मान को डिक्लेयर करिया पड़ला WHO को कि अनयूजुअल केसेस गुडा बाहर छु. तो लास्टली मार्च 21 तारिख दिन WHO याको पैंडेमिक फॉर्मेट रे डिक्लेयर करथिले. तो से सिनारियो होची कोविड-19. तो प्रथमे ताको ना दोथिले जे 2019 नोवेल कोरोना वायरस पर ताको देले कोविड-19. नेक्स्ट स्लाइड प्लीज. नेक्स्ट स्लाइड प्लीज. कोविड-19 कहीं कहला ताकि कोरोना वायरस से तो गोटे आइसोलेशन करले वायरस को से वायरस टा कोरोना वाला देखा हला. कोरोना रे गोटे इंटरेस्टिंग एस्पेक्ट वायरसेस जेतो आपण स्ट्रक्चरली देखके बहुत ब्यूटीफुल देखा जाय. मेजॉरिटी वायरसेस दे आर हेल्पफुल टू द बॉडी बट ऑफ कोर्स केते अछि जोड़ा सो हार्मफुल हे पारे. ये कोरोना वायरस रो मेजॉरिटी वायरसेस दे रिमेन एज ए कमेंसल हमर ह्यूमन बीइंग्स रे. बट ये जो कोरोना वायरस हम देखु छे 2019 ये पैथोजेनिक वायरस ऊपर प्रकाश रही आर गोटे एनवेलप अच्छी ये सिंगल स्टैंडर्ड RNA वायरस अच्छी आपको जदि आमे तार जेनेटिक मटेरियल को देखिबा ताले ये 29.9 मतलब 30,000 बेस सहित अच्छी. ये जो कोरोना वायरस आ सरफेस रे स्पाइक्स प्रोटीन्स प्रोजेक्टेड अच्छी. तो सरफेस रे स्पाइक प्रोटीन एते सुंदर प्रोजेक्टेड अछि ताको गोटे रूप दोछि कोरोना जेमति हम सो देखाउछि हम सो जो ग्रहण समय रे जेमति हम देखुचे गोल्डन डायमंड रिंग कोरोना सी टाइप रो लुक पई आपको कोरोना वायरस को आला. नेचुरली ये एनिमल्स रे बहुत सारा एनिमल्स मिलंती कि ह्यूमन बीइंग्स रे भी मानकर इन्फेक्शन रहिछि. नेक्स्ट स्लाइड. नेक्स्ट प्लीज. सो देखिए यार सबुठो मेन होछि स्पाइक प्रोटीन. तो सरफेस रे स्पाइक प्रोटीन रहिछि ये स्पाइक प्रोटीन बेसिकली कोन एटा को क्लोज फॉर्म रे थाए जेतोळे ये इन्फेक्शन करियो जाय अटैचमेंट हुए जो पिंक सरफेसेस एवडा सो ह्यूमन SCE2 रिसेप्टर को जाय के बाइंड करंती. तो जेतोळे ह्यूमन SCE2 रिसेप्टर बाइंड करे सेतोळे ये जो रेड पॉइंट्स अछि इट इज फ्यूरिन तक क्लीव करे. तो जेतो फ्यूरिन क्लीव करे तो ये जो सरफेस प्रोटीन तक S1 S2 दीटा फॉर्म रे थाए. तो S1 टा ऊपर रह जाए S2 ए भीतर को ह्यूमन बॉडी भीतर को पसे. सो एटा होछि तार यूजुअल पैथोजेनेसिस. का अर्थ जे जो स्पाइक प्रोटीन जतो खुली जाए तारो अटैचमेंट बढ़ी जाए और से बहुत सारा रिसेप्टर्स को बाइंड करिया अपनी सक्षम हो जाए. नेक्स्ट स्लाइड प्लीज. तो ये जो देखिए ये कोरोना वायरस जतो अछि वेरिएंट्स स्लाइड मिस हो जते मझे आपको पूरी स्लाइड होई
केतेगुडी स्लाइड्स स्किप करा ही जाइछला देयर इज बाय स्टोर सर सो
तो ये बेसिकली कोन होची कि तो वायरसेस मल्टीप्लाई करन बॉडी रे दुईटा टाइप वायरस रहे गोटे होची RNA वायरस गोटे DNA. एक्चुअली वायरसेस रे केबे DNA RNA कंबाइन न थाए. कि बेसिक कांसेप्ट हम समस्त जानिया दरकार. ये भीतर गोटे सिस्टम अछि जतो DNA वायरस थाए दे आर वेरी स्टेबल. इनकर स्टेटस बहुत कम आसे सेते आपण देखिबे DNA वायरसेस रो आउटब्रेक पैंडेमिक ऑलमोस्ट नील थाए. किंतु आरएनए वायरसेस प्रॉब्लम कौन हुए एमान प्रूफ रीडिंग जो हुए जेनेटिक मटेरियल आरएनए रे से प्रूफ रीडिंग रे किसी गलती रह जाए तो ये आरएनए वायरसेस मल्टीप्लाई बहुत जल्दी करती और सेमानकर जो प्रूफ रीडिंग थाए से प्रूफ रीडिंग रे एररनेस रहबा जोगु मेनी बॉडी भीतर बहुत वैरायटीज तार जो स्ट्रेन्स डेवलप हो जाती से स्ट्रेन को आम सब गोटे म्यूटेंट को जो आप देखिए अन्य भाइरसेस लाइक हेपेटाइटिस सी भाइरस नहीं एचआईवी भाइरस से जगह आम कहू क्लाड क्लाड पर आम क्वासी स्पेसीज तापर स्ट्रेन किंतु कोविड से क्लाड अवश्य अच्छी लोक कहती किंतु आम वेरिएंट नाम रे दि जाए तो सेमती टाइप वेरिएंट्स को जब आम देखा जाए ताले आम पाखे सब 3-4टा वेरिएंट जो भीतर आसी लाइक यूके वेरिएंट जो डिसेंबर 20 रे डिटेक्ट होता साउथ आफ्रिका वेरिएंट तापर जनवरी ब्राजिल वेरिएंट 3टा को वेरिएंट ये 3टा को जहाँ सर्कुलेशन आसी दे हैव रियली क्रिएटेड ए हैवक इन दी सोसाइटी एंड कम्युनिटी से समस्ते स्कैर्ड आउट ये अछंती नेक्स्ट स्लाइड प्लीज तो डब्ल्यूएचओ कौन करछि से ये सब जति सब स्ट्रेन जतोल आसिला ये स्ट्रेन गुडा को गोटे डेफिनेशन दबा पई जे ताको क्लिनिकली ताको कैरेक्टराइज करछन्ती क्लिनिकल मींस तारो आउटकम तारो क्लिनिकल सिग्निफिकेंस और डिजीज ऊपर ये आपको देखि कि सेमान ताको क्लासिफाई करियो चाहिए ता क्लासिफिकेशन रो बेसिस हला जते सब वेरिएंट्स अछन्ती ताको हम वेरिएंट्स ऑफ ताको इंटरेस्ट और वेरिएंट्स ऑफ कंसर्न और दीटा इंपोर्टेंट फॉर्म में ताको रखियो चाहिए वेरिएंट्स ऑफ इंटरेस्ट कोन ये जो जते सब कोविड वेरिएंट्स बाहर चंती एमान को किसी न किसी सेमानकर क्लिनिकल सिग्निफिकेंस रहिछि सो ये जो वेरिएंट्स हला ये ओडा जो गोटे लिनिएज रे आसंती तो ये बी लिनिएज हम तापर नेक्स्ट स्लाइड रे कहबी लिनिएज कोट आछि तो ये बी लिनिएज जते बाहर चंती सोडा सु क्वाइट सिग्निफिकेंट तांकर किसी न किसी सिग्निफिकेंस रहिछि तो ये बिकॉज एमान को भीतर कौन थाए न्यूट्रलाइजिंग एंटीबॉडी अगेंस्ट आगु जो जन लोक इन्फेक्टेड है तार रिकवरी है और वैक्सीनेशन है तार एंटीबॉडी जदि न्यूट्रलाइजेशन करियारे किछि सक्षम रहंतिनी कम रहे और ट्रीटमेंट एफिकेसी रेट कम रहे और ट्रांसमिशन रे जदि बढ़ी गला ताल ताको इंटरेस्ट फॉर्म रे अनायला यार मात्राटा जतो अधिका है जाए इट कम्स इनटू ए मॉर्बिड कंडीशन जेमति कहते ना मोर सीवियर डिजीज लाइक हॉस्पिटलाइजेशन और डेथ और नॉट सिग्निफिकेंट रिडक्शन इन न्यूट्रलाइजिंग एंटीबॉडी जो होची और ट्रीटमेंट फेलोर कंडीशन रे केते जगह आसी होची और डायग्नोस्टिक डायलेमा रह गला जो डायग्नोस्टिक करिवार से स्टेन ओडा डिफिकल्ट है ताले ताको हमें वेरिएंट ऑफ कंसर्न वी आर रियली कंसर्न फॉर दिस वेरिएंट्स या कोहा जाय ना डब्ल्यूएचओ कोन करले जते सो स्टेन बाहला सेमान को डिफरेंट ऑर्गेनाइजेशंस डिफरेंट क्लासिफिकेशन करले लाइक डब्ल्यूएचओ तो कोन करले अल्फा बीटा गामा और डेल्टा एबे जेंति हम डेल्टा कहूचे सो ये डेल्टा वेरिएंट रहला एटा तो पैंगो लिनिएज सेमान को कोन करले बी ए बी सी डी करके सेमान को लिनिएज आरंभ करले जा द्वारा बी लिनिएज जते सो स्ट्रेन रहला सेडा सो काफी सिग्निफिकेंट रहला बी लिनिएज पैंगो लिनिएज कहले इवन आम पाखे अच्छे जीएस एआईडी जो मैंने से क्लैड वेरिएंट क्लैड अनुसार से क्लासिफाई कले सो यही हिसाब आम पाखे अल्फा बीटा गामा और डेल्टा सब बी रही ये सब नंबर्स तार सिक्वेंशियल नंबर्स ऑफ स्ट्रेन्स रहे सब एंड मोर इम्पोर्टेंट कह गले डेल्टा स्ट्रेन जोटा कि हम इंडिया रे स्टार्ट होती जोटा हमर कंसर्न रहला और टिल अप्रैल पर्यंत ये जस्ट वेरिएंट ऑफ इंटरेस्ट हिसाब से रही किंतु मेरे तार सिग्निफिकेंस बढ़िया जो डब्ल्यूएचओ इट हैज कंसर्न इनटू वेरिएंट ऑफ कंसर्न रे कन्वर्ट कर दिसंती प्रेजेंटली नेक्स्ट स्लाइड प्लीज तो यही जिनस रहला जोटा हम कथा होतले बी लिनिएज रे जेतो B117 हैला ताको हम अल्फा स्ट्रेन कहले तो अल्फा वेरिएंट जोटा बेसिकली यूके वेरिएंट हैला ये वेरिएंट रे कोन होची 23 म्यूटेशंस आस्ते धीरे सेतरो जो म्यूटेशन हुए से म्यूटेशन रे दीटा टाइप हुए एदरे ता कोनती नॉन सिनोनिमस और सिनोनिमस तो सिनोनिमस म्यूटेशन हुए सेटा सब सिग्निफिकेंट रहे से साइलेंटली रह जाए बट मोर इंपोर्टेंट होचन जोटा सब नॉन सिनोनिमस तो सेवडा सब समटाइम्स दे रिफ्लेक्ट इन ए डिफरेंट फॉर्म केतळ क्लिनिकल सिवियरिटी केतळ ट्रांसमिशन रे केतळ न्यूट्रलाइजिंग कैपेसिटी रे ये सब टाइप रे सेवडा सब मैनिफेस्ट हुए एज पर द टाइप ऑफ म्यूटेशन से तो सेमती यूके वेरिएंट रे जेतो 14+3 17 म्यूटेशंस जोड़ा सो इंपोर्टेंट रहले तार मोस्ट सिग्नेचर म्यूटेशन हैला 501 तो नाउ यूके पर जेतो देखा हला ये नॉट ओनली यूके ऑल थ्रू 83 कंट्रीज रे मोर देन 57000 केसेस ग्लोबली रिपोर्ट हेची यूएसए एंड ईयू एंड ऑल कंट्रीज इंडिया रे मेजॉरिटी पार्ट्स रे धीरे धीरे स्ट्रेन आसवा लागला एंड पर देखा गला जे 70% स्ट्रेन्स इन इंडिया सब यूके वेरिएंट कन्वर्ट होला आउ एम्स रे गोटे स्टडी देखा गला 7% केसेस रे ब्रेक थ्रू भी देखा इतला सो इट इज समहाउ कमिंग टू ए कंसर्न कि जो ब्रेक थ्रू होची ऑल स्ट्रेन्स दे आर बीइंग टेकन केयर ऑफ बाय वन पर्टिकुलर वेरिएंट जो गोटे वेरिएंट आउट ए वेरिएंट को रिप्लेस कर दोची ओवर ए शॉर्ट पीरियड ऑफ टाइम सेटा होची मोर कंसर्न से समय साइमल्टेनियसली था साउथ अफ्रीकन वेरिएंट जो B1351 ताको बीटा बोली कहला अल्फा प्रोटीन यूके तापर देले बीटा सो ये बीटा वेरिएंट से भी जो वेरिएशन 17 म्यूटेशन हेतला तरे मोस्टली जो म्यूटेशन हुए एटा सो स्पाइक प्रोटीन और स्पाइक प्रोटीन का होची प्रोटीन फॉर द अटैचमेंट जेतोले म्यूटेशन हबो तने बॉडी से तो अटैचमेंट हबो सेतरे कोन एदर इट विल इंक्रीज द अटैचमेंट और इट विल इंक्रीज द सिवियरिटी और जेतोले अटैचमेंट होची आमी सपोज आमी किछ गोटे एंटीबॉडी प्रोड्यूस करछे और वैक्सीन नोचे हमर कंसर्न होची आम पाखे जो एंटीबॉडी और वैक्सीन रहला सेटा ये जो म्यूटेशन को टैकल कर परिबो कि नहीं कर परिबो सेटा होची आमनकर कंसर्न तो ये जो बीटा म्यूटेशन देखाला इतरा हाई बाइंडिंग एफिनिटी फॉर एसी देखाला और इंटरेस्टिंग जातला ये कोन ये जो आरबीडी रिसेप्टर बाइंडिंग डोमेन जो रहे जो रिसेप्टर बाइंड करे स्पाइक प्रोटीन बाइंड करे से जो न्यूट्रलाइजिंग एंटीबॉडी दीटा मेजर न्यूट्रल एंटीबॉडी एस्केप से होता और लूप रे गुड एंटीबॉडी थला ताकू एस्केप मतलब इसमें एथरे कोन एस्केप म्यूटेंट हिसाब रे ये बीटाटा रिफ्लेक्टेड है नेक्स्ट स्लाइड सो तापर नेक्स्ट वेरिएंट आसला जनवरी सेटा हला ब्राजीलियन वेरिएंट सो जेतो नंबर हुए तीनटा नंबर पर जो एक्स्ट्रा गुटे नंबर आसे ताकू दे देंतु आलियास आउट नंबर तो B2 आपको P को नहीं है बट दिस इज बेसिकली B लिनिएज ओनली तो एथरे जो सिग्नेचर म्यूटेशन रहले सो एथरे 484 आउ के 417 ए दीटा म्यूटेशन एथरे एडिशनल रही कि ब्राजीलियन वेरिएंट एथरे भी सिमिलर टाइप का इन्फेक्शन हायर इन्फेक्शन रेट और ट्रांसमिशन हाई एसो एथरे देखा जाता नेक्स्ट स्लाइड तो हमारा कंसर्न रहला बीटा डेल्टा now delta has come up जो रे कि ताकू B11617 और 617 रे तीनटा टाइप रहला 617.1 0.2 0.3 इंटरेस्टिंगली देखा गला जे 617.1 और 0.3 ते से माने खाली इंटरेस्ट ऊपर रह गले माने तांकर जो इन्फेक्शन तांकर जो स्प्रेड डिजीज मॉर्बिडिटी एते हाई नथला जति 2 रे रहला तो पई आपको दियाला B11617.2 डेल्टा और ये दिस इज वेरिएंट ऑफ कंसर्न ग्रुप रे ये रिफ्लेक्ट करला ये जो वेरिएंट एथरे कोन 452 और 681 जो दीटा म्यूटेशन रहले ए दीटा आपन बोली काफी इंपोर्टेंस रहला और ये न्यूट्रलाइजिंग एंटीबॉडी देखा गला जे अराउंड 60% केस डिक्रीज करछ न्यूट्रलाइजिंग एंटीबॉडी और जो स्ट्रेन्स देखा होछ 63-70% स्ट्रेन्स धीरे धीरे कन्वर्ट होचंती डेल्टा फॉर्म रे सो दिस इज व्हाट जो जिनसो हम देखले इंडिया रे डेल्टा started from delta and it has crossed to many countries तापर जो ग्रेजुअली फर्दर देखा गला जे डेल्टा प्लस मतलब 417 गुटे म्यूटेशन एडिशनल ला जो 417 बीटा रे थिला अब बीटा रे जो ये 417 रो इंपोर्टेंस कोन कि ये लिनिएज था ये म्यूटेशन था ते लूप N5 लूप न्यूट्रलाइजिंग रे से डिफेक्टिव रहे सो दैट इज वन ऑफ द इंपोर्टेंट पॉइंट जो डेल्टा प्लस रे आसवा द्वारा लोकों भीतर कोन गुटे एप्रिहेंशन बढ़ी गला कहीं डेल्टा है कि एतकी जदी इन्फेक्शन फेज 2 रे हेची ताहले डेल्टा प्लस जदी आसियो तो तान क्वेश्चन आसला कोन हम फेज 3 को पहुंचले नहीं कि तो एक कहबाटा बहुत डिफिकल्ट स्टेज रे किंतु जो प्रकार चाली छी अबे डेल्टा जो फेज 2 टिके डिक्रीज डाउन ट्रेंड चाली छी नाउ वी हैव टू वेरी प्रिकॉशन हमर बढ़िया दरकार आ प्रिपेयर्डनेस आल्सो बढ़िया दरकार सो दैट वी आर नॉट लैंडिंग इनटू फेज 3 ऑफ दिस स्टेज तो ये उड़ा सो जो देखा होची उड़ा सो कंबाइंड वे रे देखा होची जो बीटा डेल्टा रे कोन जो म्यूटेशंस अछि से जस्ट रिफ्लेक्ट कराय नेक्स्ट स्लाइड प्लीज नेक्स्ट स्लाइड तो नाउ सब किछ अछि ताले क्वेश्चन आसला कोन जदी एते वेरिएंट्स आछी और हमें एते एडवोकेसी करछे जे वैक्सीन जदी हम वैक्सीन दोचे वी शुड बी श्योर दैट वैक्सीन काम करिया दरकार दे शुड वर्क विथ द नेचुरल स्ट्रेन दे शुड आल्सो वर्क विथ द वेरिएंट्स अब वेरिएंट्स इतने फास्ट डेवलप होचे वैक्सीन जतो तयारी हेची गोटे फॉर्म को नेकी तयारी हेची नाउ इतने वेरिएंट्स दे आसी जीवो ताले आप नेचुरली समस्त मन रे अप्रेंशन हबो जे वैक्सीन हमर से जो ऑलरेडी जो न्यू स्ट्रेन आछे सब काम करियो कि न करियो तो आम पाखे जेमती mRNA वैक्सीन अच्छी DNA वैक्सीन अच्छी इनएक्टिवेटेड वैक्सीन अच्छी लाइव रिकमेंडेड वैक्सीन सब अच्छी नेक्स्ट स्लाइड प्लीज तो जदि से वैक्सीन अच्छी जते वर्तमान नेक्स्ट स्लाइड प्लीज तो जते वैक्सीन अच्छी वर्तमान समस्त सब वैक्सीन गुड़ा सहित ट्राई कर देखछंती एज ऑफ नाउ यह देखाई जे प्रत्येक जो वेरिएंट आछंती बीटा अल्फा और डेल्टा से मानकर डेफिनेटली न्यूट्रलाइजिंग कैपेसिटी कम है कोटी 3 टाइम्स कम है कोटी 6 टाइम्स कम है किंतु से सब समस्त पाखे न्यूट्रलाइजिंग कैपेसिटी अच्छी इट इज नॉट जीरो दे आर स्टिल एबल टू न्यूट्रलाइज सो ता अर्थ होची स्टिल वी आर वेरी होपफुल कि हमर वैक्सीन जते अछि सेडा सु काम करिवो और वी शुड नॉट बी वरीड दैट कि आमी विल नॉट हैव एनीथिंग फॉर प्रिवेंशन ऑफ दिस डिजीज तो वैक्सीनेशन इज वेरी इंपोर्टेंट बट जहाँ भी हबो द मोस्ट इंपोर्टेंट होची कोविड एप्रोप्रिएटनेस मतलब जोटा होची मास्किंग डिस्टेंसिंग आउ हैंड वॉशिंग तो मास्किंग और डिस्टेंसिंग जहाँ भी जो वेरिएंट आसु यदि हमें प्रॉपर मास्किंग करचे और डिस्टेंस करचे हार्डली यू विल फाइंड एनी चांस दैट दे विल कम टू यू सो ये जिनसो को फॉलो करले देन वी विल बी क्वाइट ए बिट सेफ सो यह लास्ट कथा थैंक यू वेरी मच समय भी कम अच्छी तो
थैंक यू राधा भाई
Atush bhai.
Atush sir
Thank you, Professor Ratha. Thank you very much. Outstanding presentation. Upon a difficult topic को at a simple भाव में present कले, it will be a big help to our viewers. We have received so many questions. We will keep it for the end. So please hang in there. So we have so many questions. Even I have also so many questions. I am पचारियो आपन को in the end. Okay. Now let's move on. The next speaker is Dr. Ajit Kayal. Dr. Ajit Kayal he is my classmate from SCB Medical College, Cuttack. आमे 5 वर्ष सांगरे पढ़िलु. Then he left us. He got a post-graduation seat in PGI Chandigarh. So he moved to Chandigarh. Then he did his post-graduation. Then he was faculty in All India Institute of Medical Science for a few years. Then he got the invitation from UK. So he left India and he moved to UK. Currently, he is the bariatric anesthesiologist, senior consultant, and he is working in St. George Hospital in the University of London. Ajit has published many articles, more than 15 publications in different journals in the world. He is very, very famous, not only in London, also in the UK. People know, people take his opinion in difficult cases. So now, without further ado, I am going to request Dr. Kayal to talk on the topic which he is going to speak, Aji Kohiba, first and second wave of COVID-19. Ajit, please go ahead.
Thank you very much, Atush Nayak, and he's my friend and respected chairman and Dr. Nanakram and everybody's, and good evening to everyone who is watching this program. And I'll try my best to explain to everyone as simple as possible, because I know the people, whoever is watching this program, they're mostly not medical people, they are non-medical people. So I'll try my best to explain as much as possible. Can you start my slide, please? Right, okay. Thank you very much. This is I am, and oh no, we have jumped to the third slide. The state goes to the third slide. Okay, now what is the difference? This is the thing that when the virus originated first, that is the original strain, that is called alpha variant. Not alpha variant, that's called original variant from the Chinese. And what is the sign and symptoms of the two variants? Because when they come to the UK, the strain has changed their sign and symptoms. So when they were started in the Chinese, the symptoms were fever, new continuous cough, loss of taste, loss of smell. That was there. But when they have came to UK, they have changed to the Kent variant. Kent variant, they are producing in the different signs and symptoms. Like they usually put in cough, sore throat, fatigability, and muscle ache. And apart from that, they don't give any loss of taste or smell. But in India, I'll say that in February, March, where the second wave started, they have anticipated about, we have seen is that about 55% of the Kent variant and 45% of the Delta variant, that is in the month of March. So probably it might be, that's the reason probably while towards the end of March, April, we're getting more of Delta variant in India rather than in UK. But UK, we have started now, the Delta variant is here now. Okay, next slide, please. Now, what is the Delta variant? Is a different, as I mentioned it before, about this strain is spread about rapidly 40 to 60% more transmissible than Alpha variant. And this is said by the European Central Disease that it mostly affected the lung, that the Delta variant mostly affected in the lung rather than goes to the sore throat or anywhere else. So what is the difference is that's India, when you see that most of the people in the second wave, they feel of breathlessness. While in the first wave, they used to produce the dry cough, joint pain, headache, and more. But in India, this Delta variant, same in United Kingdom, now they are producing the different symptom. They're producing like a bad cold, sore throat, running nose, fever, cough is ever is rare. The symptoms are very rare, we can see now. Next slide, please. Now, Delta variant is a plus, as Dr. Rath Professor Rath has mentioned it, that Delta, we have until June 16, in UK, we have 41 cases, US 83 cases, in India, 163 cases, apart from Canada, Japan, Nepal, Portuguese, Russia, Switzerland, and Turkey. They have all detected this Delta plus variant, but they have not released any data about the risk, about the symptoms, because the data is very, very inadequate, because we need more data to produce. But what we came to know from in UK, because we received about 41 cases, they says that it is increased transmissibility, means it's more faster spreader than Delta variant. And they strongly bind to the lung cells, and they produce more lung damage compared to the Delta variant. It has been said that potential reduction in antibody response, means whatever the body is produced, the antibody might not be respond to the Delta variant, Delta plus variant. It might cause, the term is called immune escape, might not develop too much of immunity in the body. But it has been seen is that people are using in USA the monoclonal antibody therapy. It does not work in Delta plus variant. That's what we have come to know. Next slide, please. So what is the difference between the first wave and second wave? Basically, this is whole of the Europe. I'm not very confident to say about the first variant of the India, but definitely in difference in Europe and Asia is that during the first wave, the people are, I think, betterly trained themselves to control their symptoms like diabetes mellitus and hypertension, because most of the people have died. Those who are people are diabetes, hypertension, and acute respiratory syndrome. But in the second variant, the second wave, the people have better control of hypertension and diabetes. But more of the people are died because of the smoking habit, acute respiratory distress syndrome, plus neurological disease. Next slide, please. Next slide, please. Now, what happened in India? Say India, can you get seconds? Next slide, please. All the information I get from the ICMR and AIMS, All India Institute plus PGI, this is the waves where we can compare United States, India, Brazil, France, Russia, and United Kingdom. You can see this is the color of the India that is going up in the month of April, but in second wave, that is the second wave. But we have already crosses the second wave, and India is having has second wave probably quite late in the month of April. But where the USA, UK, France, Brazil, they have already gone through it. for the second wave. And this is the amount of death rate. If you compare the death rate of India compared to any other country, developed country, it seems it's much less compared to, you can compare the death rate of the USA, UK, but it's still much less compared to any other country. Next slide, please. Now, what is the positivity rate? Means how many people are positive in the whole of the India. You can see the Delhi positivity rate is the highest. The first they appear in the 1st of April peak is about 30%. But by the time they came in 23rd of May, they came down to about 5%. But here is the Odisha age. Initially, they started about 22% in positivity rate. That is the 1st of April, and then came down to about 19% in the month of probably 23rd of May. So that is how. But compared to the Odisha, the other state is also affected quite a lot. Thanks. Next slide, please. Now, this is the daily COVID cases in India, how they started. This is the 7 days. This is the first wave. It started in July, and then average about 100,000 cases are increasing. But the second wave, they started in April 22nd. It's very fast, and they're very steep. Rather than there is more flat curve, and here is the curve is very steep. Means per day the number of cases is much faster. Next slide, please. So what is the difference between the first wave, second wave? We can see that the first wave, the higher proportion of the asymptomatic individual got admitted in the second wave. Higher proportion of admitted in the patients showed breathlessness in the second wave, and the patients with the sore throat and dry cough higher in the first wave. Next slide, please. So this is the age variability and admission rate in the hospital. You can see this is the first wave is the red color and second wave is in the pink color. The number of patients, like people age between 0 to 19, the admission rate is much higher in the second wave, and 20 to 24 years is much higher in the second wave, and more than 30 years is also much higher in the second wave compared to the first wave. So there are more younger generation they affected in the second wave rather than the first wave. And the mortality rate, if you see the more of the younger age group, they are affected either in the both waves, but you can see the more younger age group or second wave is more drastically affected in the younger age group rather than the older age group. Next slide, please. Now, how many ventilator requirement in the first wave and second wave? The ventilator requirement, you can see 37.3% during the first wave, and the second wave 27.8%. And compared to the oxygen requirement, the first and second wave is the first wave that does not need much oxygen. People are running for the ventilator and ventilator bed, where the second wave is the people are looking for more oxygen. So 54.5% people are looking, they need oxygen. Next slide, please. So this is my last slide. This is the situation shown as that we are all in the same, regardless of our religion, culture, custom, whether you are poor or rich. Virtually simply does not choose. The virus simply does not choose. It connected us in the way it shows us that we should all stick together during this chaos. While many of us is panic, it shows us the weight of humanity. It reminds us who we are, and maybe world will be finally changed. Thanks. Thank you very much.
Excellent presentation, Dr. Kyle. Delta virus has created a havoc all over the world. Apan mane samaste janithibe, of course in India it is the predominant virus. In UK it is prevalent more than 90% of COVID cases, and the US the numbers are going up. Now it is more than, today's report is more than 20.6% of COVID infection because of Delta variant. Thank you, Ajit. We have a lot of questions for you. We'll discuss in the end. Now we'll move on to our next speaker for today, Dr. Samarendra Misra. Again, Samarendra is my classmate. We studied 5 years, Ekasathre Padilu, MBBS. Samarendra is MD, MCTM, and MPH. And he is currently in Delhi, and he's one of the authority in public health and tropical diseases. आपण माने समरेंद्र को देखिथिबे सुनिथिबे. He is one of our core member of the OSA Health and Wellness Group. He is an excellent orator and eloquent speaker. And besides that, he is a senior technical advisor to many organizations in India, including Government of India, UNAIDS, and Clinton Foundation in India. He is also chairperson of Partnership for TB Care and Control in Delhi. So he is well known in Delhi and Odisha and all over the country. So one more thing I wanted to say, when my family members got COVID, the first person I spoke is Samarendra. I wanted his advice before I do anything. So as I said, he's one of the best in tropical diseases, in infectious diseases, in public health. So without further ado, I'm going to request Dr. Misra to talk on the topic. His topic for today is there any potential? Is there any potential for third wave in India? Really, is it coming, or it is a just people are talking about it? So, Dr. Misra, please.
Thank you. Namaskar, everybody. I know it's a little late in the evening in India. I also namaskar to all my fellow panelists and the team members and the organizers. Devashish has been a champion in.
Mute.
Somebody is muted. Repeat it.
Sorry. Namaskar, everybody. Good evening and across the globe. I would also like to thank all my fellow panelists and colleagues who have spoken, and also the moderators, coordinators. Devashish has been a champion in organizing all this. So again, thank you very much for you and your team. Tosu, you have also been an excellent moderator for so many sessions now. Since last 6 months we have been having. We hope that ame jaha bhi discuss korchu, it is helping people, because जत्ते जानकारी लोगों को दिया जिबा कथा जदि हम थ्रू दिस फोरम हमें जदि दे पारिबो, because awareness and knowledge is the first step to understand ये pandemic रे काई के एमती असुविधा होची. हमको एतला कुहा होचे मास्क पिंदी तो हम बाहर को बाहरनी काई हमें बाहर छु कोन हमें अजणा रे बाहर छु हमें जानी सुनी बाहर छु. So what are the reasons? लोगों को बुझवा समझवा is also a very difficult thing. But let's go move. Aji, I will only discuss a little bit practically what we know. Third wave आसीबो कि न आसीबो and काई की आसीबो and what we should do. बहुत किसी जणा नहीं about third wave, but as you know, and also said, प्रथम 2 मास एप्रिल और मे रे हमर समस्त 24 घंटा काम थिला. एते कॉल आसुथला, एते एडमिशन दरकार, काको ऑक्सीजन बेड दरकार, काको वेंटिलेटर दरकार, ऑल अक्रॉस इंडिया. दिल्ली रू पेशेंट मान को हमें जयपुर मीरठ रे एडमिट करछु, कने दिल्ली रे बेड मिललानी. सो वी शुड नॉट फेस सच अ प्रॉब्लम अगेन. थर्ड वेव हमें शायद संभाली परिबानी. इट विल बी वेरी डिफिकल्ट इफ इट कम्स इन द सेम सीरियसनेस एज द सेकंड वेव. बहुत लोगों को जानी छी एमती की लोक नहाती जानकर फैमिली मेंबर somebody has not been affected. Many of our people हम तांका family members have lost their lives, have been affected by COVID. बहुत serious है कि बाहर के छंदी एबे भी recover करूछंती. And the other thing I would like to just warn that third wave कथावार्ता में करछु, but second wave sorry नहीं. Today news is 75 district रे still the prevalence rate is 10% to besi. So we have still a second wave going on in 75 districts. So इले मास्क खोलिवा किस दरकार ने, बाहर को भारिवा किस दरकार ने. मने अछि जनवरी तो फर्स्ट केसेस बॉम्बे रे भारिला of the delta variant and cases started happening. सेतोल लोक माने समस्त कहला सॉरी गला कोविड हम कि हम इंडिया रे बहुत स्ट्रांग हम इम्यूनिटी बहुत स्ट्रांग, कोविड किछ होबन ता 2 मास भितरे एते कैटास्ट्रोफी एते इफेक्ट हला लोकन को that we should not be taking a chance again. My first slide please. Now move ताको question answer भावर रखी छी and I will discuss जहाँ भी करिया. Should we anticipate and prepare for a potential second wave? एबे जणा ने बहुत लोक कहउचंदी आसीबो, जोरे आसीबो, आसीबोनी, अक्टोबर रे आसीबो, जुलाई रे आसीबो, डिसेंबर रे आसीबो. Actually the answer is एबे हम जानिनु केबे आसीबो, but definitely आसीबो. ना काई की आसीबो? As you all know, every time what a variant नुआ भारे वायरस वेरिएशन कहीं की करे से भी बंचिया को चाहे आम जो वैक्सीन मारिया चाहूँ कि मेडिसिन मारिया चाहूँ सी तार बंचापी तार चेंज करे तार शेप चेंज करे जहाँ प्रोफेसर रथ कहले तार म्यूटेशन रे तार जो जेनेटिक मटेरियल से सब चेंज हुए ना सेकेंड वेव जो आमर है इट वाज द डेल्टा वेरिएंट 2 मास लगिला जनवरी फेब्रुआरी धीरे धीरे स्प्रेड कला पिकअप है केसेस तापरे मार्च एप्रिल रे इट स्प्रेड लाइक एनीथिंग आमर जो सेकेंड वेव रे जिते इन्फेक्शन है 70 to 80% अक्रॉस इंडिया वाज द डेल्टा वेरिएंट ये नहीं कि हमारा अल्फा वेरिएंट नथिला अल्फा वेरिएंट वाज स्टिल सर्कुलेटिंग बट डेल्टा वेरिएंट वाज द मेजर दैट इज व्हाई द सिचुएशन बिकेम मोर सीरियस बिकॉज आमर क्लिनिकल कंडीशन बहुत जल्दी लोक बीमार पड़ले जमती डॉक्टर अजित कायल कहले आमर बहुत ऑक्सीजन बेसी दरकार पड़ला वेंटिलेटर दरकार पड़ला एटा फर्स्ट वेव रे नथिला सेकेंड वेव रे सो देयर वाज अ टाइम वी डू नॉट नो थर्ड वेव रे कौन दरकार पड़ो आज डॉक्टर गुलेरिया को थिला कि जे होस्ट हे पारे एते सीरियस न ही पारे थर्ड वेव बट सी भी कहला मु एते क्लियरली कहि परिबे ने हम पाखरे डेटा इंफॉर्मेशन नाही सो आसीबो कि न आसीबो लेट अस बी प्रिपेयर्ड द सेकंड इज with few cases now it is too early to predict the nature of infection कितने जन इन्फेक्ट हेबे और जो माने इन्फेक्ट हेबे कितने सीरियस हबो बीमारी we still do not know because as of today's official data only 50 cases have been detected of delta plus variant number 1 number 2 मो 3-4 घंटा आगु सुनली ओडिसा रे also first case has been reported आगुर थिला 6टा ना 7टा स्टेट रे नाउ दे आर कोचने 11टा स्टेट रे डेल्टा प्लस वेरिएंट इंडिया रे आपण जानि छथि डेल्टा किछि स्प्रेड करिया को इट इज वेरी इजी लोक जीवा आसपा करथथि सो इट इज जदी स्प्रेड करियो बहुत जल्दी स्प्रेड करियो सो एले त जणा नै डेल्टा प्लस वेरिएंट केमते बिहेव करिवो थर्ड वेव केमते आसीबो सो दैट इज नाउ कैन वैक्सीन प्रोटेक्ट अस फ्रॉम डेल्टा प्लस वेरिएंट ICMR research chalichi study within 2-3 weeks we will come to know whether vaccines are going to protect but vaccine pura protect no kale to a certain extent protect karibo either infection jodi habo mild infection habo ame jani chu efficacy 70-80% so 100% नुए कोई vaccine even alpha variant रे भी ame earlier wave रे भी vaccine नेला परे भी हमको infection हेची so एथरे भी infection हमारा chance अछि but we are hoping seriousness of infection कम हबो से जगरो vaccination जत्ते जे नहीं परला जत्ते जल्दी that is very important. The other thing is that the severity of infection vary because by the time this hits amar 20 कोटी लोक already vaccinated he gale at least either first dose nahi chanti or dita dose nahi chanti so it is very important that if you speed up the vaccination the chances that severity of illness will be less. The next slide please. Now आउ गोटे बहुत कथावार्ता चलचे पिला मान को हबो केना फर्स्ट वेव रे कोहाला खाली एल्डरली कोमॉर्बिड सीनियर सिटीजन्स को अफेक्ट हबो सो पिला माने बुलिले खेलिले बिना डर रे बट पिला माने फर्स्ट वेव रे भी इन्फेक्ट हेतिले सेकंड वेव रे भी इन्फेक्ट हेचंती ना थर्ड वेव रे हेबे किछ सजेस्ट नै कि पिला मान को बेसी हबो बिकॉज़ सेकंड वेव रे पिला मान को बहुत इन्फेक्शन हेछि माइल्ड हेछि तांको एत हॉस्पिटलाइजेशन दरकार पड़नी बट सीरियस हेछि डेथ भी हेछि बट ए पर्यंत जति हमको इन्फॉर्मेशन जणा किछ ऐसे एमती किछ सजेस्टिव नै कि पिला मान को बेसी हबो बट कारण काहे ना पिला मान करो एले वैक्सीन भारी नै तो द चांसेस आर दैट पिला आमे एडल्ट माने वैक्सीन नै गले चांसेस आर पिला मान को वैक्सीनेशन नाही जे हेतु तांको इन्फेक्शन होबार चांस अछि सो हमर ये होछि कि पिला माने भी घरे मास्क पिंदिकरी सोशल डिस्टेंसिंग हैंड वॉशिंग हैज टू बी फॉलोड फॉर चिल्ड्रन आल्सो से पिला मान को हबो बेसी न होबे सब पर कथा बट प्रिवेंशन इज वेरी इंपोर्टेंट एंड दिस इज माय लास्ट स्लाइड व्हाट कैन वी डू माने समस्त गवर्नमेंट तो तार करछि बट आम हाथ रे कोन अछि वी शुड गो फॉरवर्ड एंड वैक्सीनेट जत्ते जन फैमिली मेंबर निजो को समस्त को वैक्सीनेशन जेमती आपनकर कैंप लागुछि जोटी OSG आल्सो ग्रुप इज डूइंग अ लॉट ऑफ वर्क वैक्सीनेशन कैंप ऑर्गेनाइज करछि द हेजिटेंसी जो थिला सेकंड वेव आगुरु सेटा बहुत कमी जाइछि लोक डरिकी जाउछन्ती वैक्सीनेशन एटलीस्ट दे नो सम प्रोटेक्शन ऑफ वैक्सीनेशन हबो सो से डर आस्ते आस्ते कमी जाउछ सो पीपल आर कमिंग फॉरवर्ड फॉर वैक्सीनेशन एज आई सेड पिछले 2-3 दिन आगो देखा जदी 80 लाख 90 लाख 50 लाख वैक्सीनेशन अक्रॉस द कंट्री होचे सो दैट इज अ वेरी गुड साइन वैक्सीनेशन पहली वैक्सीनेशन रो इम्यूनिटी डेवलप करिया को टाइम लागिबो सो वी हैव टू कंटिन्यू विथ कोविड एप्रोप्रिएट बिहेवियर दैट इज मास्क रो देयर इज नो सेकंड ऑप्शन सोशल डिस्टेंसिंग रो नो सेकंड ऑप्शन एंड हैंड वॉशिंग नो सेकंड ऑप्शन समस्त कहते हम काम को जीवा पड़ो हम ऑफिस जीवा पड़ो हमको ये करिया पड़ो इट इज योर कॉल यू डिसाइड what is more important more life is important or more chakiri kariba my livelihood is important So I think everybody is aware, everybody is knowledgeable. You decide कि more जीवन more important ना my livelihood more कामों करिए is more important. Remember, prevention of infection is your first option. हाँ मु बेमार है गली मु आज मो पाकर एम्स रे डॉक्टर चिन्हा मु एडमिट हेज भी सेकंड वेव रे देखिथिबे जेते एडमिट हैला परे भी आईसीयू रे भी लोको हैव लॉस्ट देयर लाइव्स. So hospitalization, medical care is the second option. We do not know. से कहते डेल्टा प्लस वेरिएंट रो मेडिसिन्स काम करिबा टिके कमी जाय पारे. जंती वैक्सीन रो एफिकेसी कमी जो मेडिसिन जो मोनोक्लोनल एंटीबॉडी जो ट्रम्प मेडिसिन कहउछंती तार भी effectiveness कमी जाय पारे. So we do not know. So prevention is the first option, and hospitalization, yes, that is नहला करबो. The last thing is केतबळे आसीबो ना. There is a lot of modeling हेची के कानपुर आईआईटी वाला मॉडल करी कहउछंती. Modeling is dependent on a lot of other factors. लोकंकर चला बुला केमती, माइग्रेशन केमती, तांकर कोविड एप्रोप्रिएट बिहेवियर केमती. जदि बेसी खोली गला एंड बेसी हमें बुला बुली आरंभ करतलु थर्ड वेव तो काली आसी जीवो. So it depends on how preventive and precautions we take. We do not know the exact time, but it will definitely come. I think that's my presentation for today evening. Thank you so much.
Thank you, Samrendra. Thank you very much. Outstanding presentation. You explained very well. As you said, prevention is better than cure. So, and with that note, and I'm going to request Dr. Sangeeta Pradhan and Dr. Julie Samantray to moderate the question and answer session, please.
Thank you, Atis bhai. So presentation sarla. Now we go to our audience. We will start with a question from Facebook Live. This is Mrs. Usarani Malik, and she has asked, 20-day recovery pare same body pain, chest pain, fever, headache hochi. Out thare reverse transcriptase PCR kariba test kariba darkar ki. I will request Dr. Kyle.
No, sure. I think even if they have, can you tell me the question again, please?
So the question is after 20 days of recovery, they're having same symptoms like body pain, chest pain, fever, headache.
Yes.
So is it necessary to do the reverse transcriptase PCR again?
No, I don't think so. It does not need any test to be done. It just because one of the effects, post-COVID effect, will be remain there for a month. Some people, they last for 3 months. So you don't have to worry. If you have a negative, you have gone through symptoms, I don't think so you need it. And at least you have an antibody in your body, so that the chances of getting next infection is much less.
Thank you, Dr. Kyle. So between me and Dr. Samantray, we will monitor the Zoom questions and Facebook. And now, Julnani, can you go over to the Zoom questions?
Someone has kirane hatto tekichanti a Redmi.
Yeah, unmute.
Please unmute kariki question pacharantu.
This is Sanjay from Dallas. So I have 2 questions. First question is for Dr. Kyle and Dr. Ratha sir. Sir, upon कहले कि there are different variants in different regions, like upon कहले South Africa रे, India रे, Australia रे, UK रे different. So तर technical type रे टी कहिबे कि कोन exactly सेटा differ करे हमन region अनुसार it is because of the climate, because of the people, or किमती कोन सेटा टिके can you please elaborate a bit technical side?
कथा होची जो वेरिएंट्स कथा चलीची डिफरेंट रीजन रे डिफरेंट टाइप ऑफ वेरिएशंस होची. तो टेक्निकली होची कोन कि जो म्यूटेशन हबो जो म्यूटेशन रे जीन रो म्यूटेशन होची सम स्ट्रेन्स दे आर डिफरेंट म्यूटेशंस देन द अदर्स. तो जेमती हमें कहथले जे गोटे 417 म्यूटेशन अछि गोटे 501Y म्यूटेशन अछि. So it is not defined कि को जगह रे को mutation हो. It is a complex scenario. People, population, genetics, then environmental factors, all those things, what must be taken care of that particular mutation is very difficult to tell. But this is an observation that these are the different, some of the different mutations happen in different places and with a different severity.
Okay.
Sir, I have a question.
Yes,
Hello.
yes, please. Yes, carry on. Yes.
Yeah, actually, we have seen many cases of post-COVID having varieties of problems. One of my patients, after staying 1 month and 15 days in the COVID hospital, when he came back here, we thought he will recover, but he didn't. I mean, in spite of all these things. Then we started little steroid, and he started little improvement. So how long we can give this steroid for him?
I think Thomas, can I answer this question, please?
Yeah, let me, I think, post-COVID, I think this is similar to the first question. Like after the Tinisota Pore, you're still having symptoms. So the couple of things we may want to do a test is actually, check the D-dimer and the CRP level. So I mean, the virus will always be positive, so there's no point to test the virus. So that's going to be positive for 6 weeks also. So if the D-dimer is positive, then we have to kind of take precautions to kind of use some form of anticoagulation. So that could be aspirin, Plavix, anything that the doctor wants. So I think the doctor has to use it. If the CRP is high, you can use a small amount of steroids to kind of shut down the inflammation. And the thing is, so you don't need steroids unless you have a high, CRP level.
Yes, if a CRP level is high, we have to, then we are also giving. But the very
so
low
if both are normal, then basically you can just observe the patient. If the patient is high risk, actually you can still use anticoagulation. But the big thing is to kind of support the patient with enough fluids, all the right things. Yeah.
Thank you.
Yeah. Okay.
So,
thank you.
Looks like the logic is anti-inflammatory effect for the inflammation. Inflammatory markers high thile steroid debe. Okay. I got a question achi Facebook group. Deepak Das pacharchandi. If one first, so se kon mean korchandi mo buche dochi se pacharchandi jodi first dose vaccine Covishield nei chanti, second dose ta se Covaxin nei paribe ki. I would request Dr. Mishra, Samrendra Mishra, to take up this question.
Yes, thank you so much. And as per the guidelines of the Government of India, same vaccine second dose both niyati dorkar. E porjanto apanko trial chalichi data porjanto jona nahi ki mix kole taro kichi fayda achi ki nuksan achi. So it is better they take both the doses of the same vaccine.
A question रा मु आगोटे extension Dr. Mishra को पचारिबी जोटा कि समस्तन को helpful हबो. जो माने इंटरनेशनल ट्रैवल प्लान करूचंती आपण गोटे पर्टिकुलर को वैक्सीन रेकमेंड करिवे कि आ कोन
कोवैक्सीन भारत बायोटेक हैज सबमिटेड तांकर डेटा WHO को पठै सालरेडी. WHO is looking at it. मते लागुच किछि दिन भितरे WHO will give approval for Covaxin. Problem है जे Covaxin को इंटरनेशनल ट्रैवल WHO लिस्टिंग रे नहीं. से जो lot of countries allow करना. So तुमको यदि Covaxin नहीं छो, there is no need to take Covishield. But यदि Covaxin नहीं छो, जो बाहर को गले, I think quarantine procedures has to be followed. That's the only thing. But it आउ किछि दिन भितरे Covaxin will also get WHO listing.
Thank you.
I would a question as how will we know it is a third wave? What symptoms are we looking for?
For Samarendra.
Okay, third wave आसीनी. जमा 50 टा केस जना पड़ची और डेल्टा प्लस वेरिएंट. अच्छा ये किसी गारंटी नहीं कि थर्ड वेव विल ओनली बी बाय डेल्टा प्लस वेरिएंट. डेल्टा वेरिएंट रे भी हेई पारे. अल्फा वेरिएंट भी स्टिल अछि जे जाइनी तार विदाय नैनी. सो वी डू नॉट नो तार सिम्पटम्स कोन हबो. एंटीसिपेट सेकंड वेव देखला पर इनिशियल को होची जे काफी सिवियर हबो इन्फेक्शन एंड डिजीजेस. बट आज जो एक्सपर्ट ग्रुप तांकर डिस्कशन चलछि से कहउछन एते सिवियर न होई पारे काना हम वैक्सीन सब नै सरछु. सो इट माइट बी लेस बट एते so it will be difficult to say now with this limited information.
Yeah, that is true. But first you have to prevent it. Take vaccine.
Yes,
exactly.
Vaccine is very important.
आमे पर्यंत कहउतलु मास्क पिंदा हाथ धुआ एबे मास्क पिंदा हाथ धुआ वैक्सीन.
Yes. घरु बाहर नहीं unnecessary.
घरु जाय.
शिमला जीवा दरकार नहीं.
ସେଇଥିପାଇଁ ମୁଁ ଗୋଟେ pitch in କରୁଛି ସେଇଥିପାଇଁ ଆମର OSA Health and Wellness Group along with OSA we are doing aggressive vaccine education and drive. It has been very successful. Aji Borahmpur re 550 लोगों को हमें vaccine दीचु खाइबक दीचु. Last week रे टिटलागढ़ रे गांव भितरे we had given 250 people vaccination continuously for ena gote maso hame vaccination drive with food and grocery we will supply. Thank you.
That's a very good incentive, very good incentive to the people. I think the people will come definitely.
Yeah, thank you.
Yeah. But also, like if you see a rise in cases over the next 3 or 4 weeks, you definitely know something is happening.
Right.
So that is kind of a predictor for your wave, because basically, every week we see what the number is. If it's rising,
right,
it's coming on. Yeah.
I think I saw some questions, Julani, on Zoom. Some new questions. Can you?
Yes, Mr. Vishwanath Pachari Chanti. Should we use ivermectin in mild cases? Dr. Mishra?
Yes, I mean, recently ivermectin has been withdrawn from the guidelines. So no doctor is promoting ivermectin because तार किसी फायदा किसी देखा गलानी in the first and second wave. But mu janiya bhitar lot of doctors are still prescribing ivermectin as a preventive precaution. But जेतोले research कोची किसी फायदा नहीं, so we will stick to that.
That's right. Jamare gote paper publication, just recent publication it does not work. It doesn't help. So.
With the second question, Zoom de Pachari Chanti, Mr. Amaresh Das, ma first nahi thile vaccine, but second dose by slot pai pare nahanti. So 3 months duration he galani. So se second dose nahi paribe na nahi. Na kemiti nebe, I think tanga question.
I think the time interval has been increased to 4 months now. So according to the latest guidelines, yes, they can take up to 4 months.
So Mr. Das, vaccine available hai apan ko ma nahi paribe second dose.
So and any delay in vaccination is never a reason not to give the second dose, because even if it is 6 months, get the vaccine, because what we've seen with other vaccines is it is still effective if you get a second dose anytime. Yeah.
Thank you.
Thank you. Another question achi, Mr. Debi Pachachanti, if I have taken both doses of Pfizer vaccine in USA and traveling to India, can I take Covaxin or Covishield as a booster?
I can take this question.
I don't think it's necessary.
The thing is, we don't know whether we can mix and match, and we don't know when the booster is going to come. There's a trial going on. So we don't know whether you can take a Covaxin, a Covishield, or whether you can take a Pfizer again. So I think we have to wait for the data. So I don't think we cannot comment at this time. So just wait for a few months, we'll come to know.
Most likely there will be boosters coming out, but the boosters may have a variation of the virus particles. So it may not be the same. It's like the flu. So they'll actually make it slightly different. So the new shot will be definitely different. So there's no point getting the same shot again. So prefer to get a better vaccine the next time. Yeah.
But further on, don't know whether we need the booster because we don't know how long the antibodies will last.
Right.
So at this stage, there's a much debate whether we really need the booster.
Yeah.
So I think let's not speculate.
Actually, booster is not advocated in India. Till now.
Yeah, no boosters.
Yeah, booster is not advocated in India.
Yeah, no boosters are advocated. Yeah, you're right. No boosters.
No, thing is that we are in the process of investigating now. We have done about 2,000 people. We are taking the blood for the antibody test, and they're serially measuring the antibody level. This is on the research process. It is still in the trial process, and they want to see when the antibody level will come down. At that same time, they want to boost the vaccine, but it is not recommended yet.
Yeah, let me add one more thing. Thing is, again, it all depends after 6 months to a year on how much of the vaccinated people are going to get sick. So if the vaccinated people are not getting sick, you don't need boosters.
Yes, you're
If
right.
the vaccinated
Absolutely.
people are getting sick, you will definitely have to look into boosters because you have to bring a variation of the vaccine again.
Right. Hey guys, a little bit, just see if you can just speak a little bit in Odia.
And one more thing, Devashish, so we don't have enough vaccines in India. First, think about.
ଓଡ଼ିଆରେ ଟିକେ କୁହନ୍ତୁ ବସନ୍ତ
First, think,
ଓଡ଼ିଆରେ କୁହନ୍ତୁ
ମୁଁ ନିଜେ ଲେଖୁଛି ଓଡ଼ିଆ ଇଂଲିଶ କହୁ ଶୁଣ ପ୍ରଥମେ ଆମର ଏନଫ୍ ଡୋଜ୍ ନାହିଁ ଭ୍ୟାକ୍ସିନେଟ୍ କରିବାକୁ ଆମ ଲୋକଙ୍କୁ ଫରଗେଟ୍ ବା ବୁଷ୍ଟର ନା ଯେତେ ଯୋଉ କ୍ୱେଶ୍ଚିନ୍ ପଚାରିଥିଲେ ଯେତେବେଳେ ମିଳୁଛି ଜଷ୍ଟ
ତ କ୍ୱେଶ୍ଚନ୍ ବୋଧେ ପ୍ରାୟ ସରି ଆସିଲାଣି
ମୋର ଗୋଟେ କ୍ୱେଶ୍ଚନ ଅଛି ମିଶ୍ର ସାର୍ ନମସ୍କାର ସାର୍ ମୁଁ କିଛି ଗ୍ରାଉଣ୍ଡ ଜିରୋ ରିଆଲିଟି ଜାଣିବା ପାଇଁ ଚାହୁଁଛି ଆମର ଏବେ ଓଡ଼ିଶାକୁ କୋଉ ଷ୍ଟେଟରୁ ଯିବାକୁ ମନା ଅଛି ଆଉ ଇଣ୍ଡିଆକୁ କୋଉ କଣ୍ଟ୍ରିରୁ ଯିବାକୁ ମନା ଅଛି ଯୋଉ ଭେରିଏଣ୍ଟସରେ ଆପଣ ଯୋଉ କନଫ୍ୟୁଜନ ଗୁଡ଼ା ଅଛି ଏବେ ସେଟା ଆପଣ ଗ୍ରାଉଣ୍ଡ ଜିରୋ ରିଆଲିଟି ମୋତେ ଜଣେଇବେ ପ୍ଲିଜ ଥ୍ୟାଙ୍କ ୟୁ
Okay, now as far as I know, international travel to June end jaye bond achi. International flights jauni only special government flights. So seita July pore again it all depends ki kholiba jo LS UK fike aur tangare defer kalani. So amaro I think from India ru international flights sabu adu ko bond achi for the time being till end of June. July re kon hoba nuwa guidelines asibo jana padibo. So everybody is being told not to travel. That is one. Now जो country भीतर from one state to another सेटा कि there is no restriction, anybody can travel from anywhere, but then समाने कहउचंदी तमे either you have a dita dose नेकरी vaccination certificate देखाओ नले गोटे RT-PCR negative देखाओ सेटा एते strictly enforce होनी काना मु कहली जेमती हमर second wave कमिला समते टिके ढिला पड़ी गले but the guidelines are still there. RT-PCR negative 48 घंटा आगु हेतिबो और दीटा डोज ऑफ वैक्सीन रो सर्टिफिकेट रहबा दरकार अदरवाइज लोको ट्रैवल करूछंती ग्राउंड जीरो
थैंक यू सर
थैंक यू के हाथ उठी चंदी जल्दी संगीता
विश्वनाथ वा raised his hand for
Parichanti, any role of colchicine jo medication ta in COVID as given in some paper a question ta ki answer kar paribe
What was the question? What was the question?
What was the question?
Any role of colchicine in
Colchicine.
I don't know. We have not started. We never prescribed any colchicine to. We have never used it actually.
Not in US also. The answer is no. For the time being, the answer is no.
Next question, Mr. Ravi Sharma Pachadi. Sorry, mu jo order re question asti se order re jauchi. So please bear with us. What's a good diet and lifestyle or precautions post-COVID? Should children have the same care or precautions? Amar gote session hi thila. Dita session ya aguru taro live bhi achi on YouTube and Facebook apan dekhi paribe.
Rashmi, is it possible to put that link on the Facebook live page or chat page if it's possible? If not, then achi amara eta pura recording achi
पूरा लिंक
आज बर्तन में पोस्ट कर दउछि
पूरा
आमे लिंक पोस्ट कर दउछु अपन देखि परिबे सेटा शेयर कर परिबे
शर्मा आमे लिंक टा अबे पोस्ट कर दबो या पर क्वेश्चन हैला मिस्टर प्रसन्न कुमार पचारछंती can antibody levels guide us in our approach to vaccine? Dr. Ratha, if you can answer this question, please.
कौन पचारछंती से
Can antibody
ମୁଁ ପଚାରୁଛି ଯେ ଆମର antibody level can guide us to our vaccination.
एक्चुअली कौन की ना वर्तमान स्टेज रे एक बहुत अर्ली फेज एटा है जोठी आमे पूरा जानी परने जे हमर एंटीबॉडी नेचुरल इन्फेक्शन परे को लेवल पर एंटीबॉडी रहउची आ से एंटीबॉडी केते मास परसिस्ट करिवो आफ्टर कन्वलेसेंस आ से एंटीबॉडी जदी अछि से एंटीबॉडी प्रोटेक्टिव अछि कि ना नॉन प्रोटेक्टिव एहा कहबा भी डिफिकल्ट स्टेज रे अछि सेत पई इट विल बी अ वेरी प्रिलिमिनरी थिंग इज फॉलोइंग इन्फेक्शन सेम पैटर्न जदी आपण वैक्सीनेशन भी नौचंती जो एंटीबॉडी होउची तारो भी वर्तमान स्टेज रे कहबा डिफिकल्ट जे वैक्सीन induced antibody productive ଅଛି କି ନହେଲେ they are just as such. So at this moment it's difficult to guide as per the antibody status.
Okay, thank you.
Sir, one doubt is after post-COVID, after how many days, or how many weeks we advocate for vaccination?
Guidelines is 3 months.
3 months. 3 months.
3 months
so by
after
that
recovery.
time, you suggest to go for antibody study?
No,
There is no need. There is no need. जो limited information हमारा available अच्छी 3 months पर है, vaccination is required. Yes.
If you have crossed 3 months without doing antibody, you go for vaccination.
Yes.
That's the same guideline in India, UK, and US. Everywhere, no antibody test.
Next question, Julie Sangeeta, Suresh Jamula has asked.
Mr. Suresh Jamula Pachachanti, is there any alternative for RT-PCR test?
No.
Dr. Ratha?
Dr.
Yes.
Rath will be answered. Is there any?
Yeah. So alternative for RT-PCR test. Yes, आम पाखरे alternative रही सेटा होची automated system जा कोंती CVNAT gene expert ये system जो cartridge based method अच्छी से RT-PCR ही हुए किंतु they are all mechanized so that हमें जो RT-PCR रे mechanically सब steps by करके 6 hours time no ये gene expert CVNAT system जदी follow करचे ताले से तेरे cartridge based रे we can get this report by 1 hour. So once the sample is taken within 1 hour you can report it. Only thing is that the correlation between RT-PCR and CVNAT or gene expert remains a question mark now. In the sense that a US FDA approved system जो gene expert cartridge based वाला सो सेमाने कोचन जहाँ भी positive आसियो ताको positive दिया हो. Positive means it is in CT value. So gene expert रे usually 41-42% देता आसे सेटा भी positive दिया जाए. However, the RT-PCR we go up to 35. So after 35 we repeat it or repeat sample करो. We don't give that positive as. So ये जो टिके difference रही थी 35 to 42 बिचरे भीतरे whether that should be given or not given is still in gray line.
Next question होची तिलक मिश्रा.
So besides it RT-PCR छाड़ले then we have also antigen test. ताको rapid antigen test वाली कुआ हुए. It is very frequently followed. अब भलो test भी. So antigen test कौन हुए कि जो भी antigen positive होची that is 100% sure. This specificity is 100%, but sensitivity will be low, around 70%, 50 to 70% very correct. तार्थ यदि rapid antigen test positive होची, then it will be COVID. If it is negative, then you should resort back to RT-PCR. यदि RT-PCR positive की gene expert positive आचो, then you can go ahead and say that is positive or negative.
Thank you, Dr. Ratu, for explaining so lucidly. So next question होची तिलक मिश्रा पचारचंदी. How hopeful shall we stay for a friend who is 36 years old, connected with ECMO from the past 10 days, already 2 times blood platelets chada helani? Thank you. Mr. Abu, I think हताश हवा कथा नुहे 36 is in his favor किंतु आमे details history जानी नो तेणु तांको डॉक्टर जहाँ अपन को कहिबे I think that would be better to follow. Personalized opinion आमे patient को न जानी की कहि परिबुनी. Hopefully that was helpful. I'm really sorry about the situation.
And I have one question for Dr. Kayal. So how India variant is differing from this UK variant? And I would a question achi, suppose I have taken my 2 doses. So how much percentage I can be safer? So if I'll be affected by this COVID.
Now the variant of strain, I mean the virus variant. The virus variant, when they have started from the China, it is called original variant. I think Dr. Rath will know, but how they're mutant. So people when are coming to UK, because as has mentioned it before, is that the survival of virus, they change their gene, change their envelope, change their spike protein. Is the same thing. They change from the original variant. When they came to UK, they have coming as a Kent variant because they have started in the Kent area. that is called alpha variant. Then followed by, now when somebody has gone from India, UK to India, they have alpha variant, particularly alpha variant was quite high in month of January and February in Punjab, Chandigarh, and in Gujarat, in Delhi area. But slowly, when they start to mutate, they slowly convert into Delta variant. So month of February and March, about 55% of the people are both mixed, both alpha variant and the Kent variant. So some of the people has come back from India to here. Now they are having Delta variant, but they start to mutating again. So that will convert into Delta variant.
Julani, next.
Sanjay, I think the second part of his question, he's saying, Sanjay is asking is like, he has taken 2 vaccines. So he lives in US. So either you have taken Moderna or Pfizer. So if you have taken Pfizer, the efficacy thila amaro 95%. But for the data from UK asila, for Delta variant, the efficacy has gone down to 88%. If you have taken Pfizer. For the Moderna, they are saying it is 100%, but actually the data is not very clear. But still, you have a very good efficacy. Anything more than 70-80% is a very good efficacy. So 88%, if you want to remember the number, 88 versus 95.
I think if you're taking the Pfizer 2 dose of vaccine,
yeah, if
your efficacy is somewhere between 95%, if it's Pfizer. And AstraZeneca, if you're taking the AstraZeneca, it is somewhere between 65 to 70%.
Yeah,
if you're taking both the doses.
Yeah, but that is for the original virus.
Yeah. No, the Delta virus.
Yeah, that is one paper 88%, but that's all right. That's around. It's a very good efficacy. There's nothing to be.
It's good efficacy. Yeah.
Thank you, Atos bhai and Ajit bhai. Thank you.
Question, Mr. N. Das Pachachanti, is baricitinib helpful in COVID treatment? I found it in a research paper. Please answer. The baricitinib, I know it's rheumatoid arthritis re use hai, and it's not FDA approved, but Dr. Thomas, apne question ta jodi answer karibe.
Yeah, those are more for the anti-inflammatory phase. So technically, we need to treat the virus. So the only thing that's good for the virus is a monoclonal antibody. So that is also available now in India. So India, Cipla is giving out the IV, which you do it for over 1 hour. So if someone is getting sick, you want to do that. And then, of course, when we go into the inflammatory phase, the proven is still dexamethasone. So the steroids are still the best. But if there's a chance to use these other medicines, that's okay. There's 2 other medicines. One is that, and there's also, I think, Actemera is another one, but I don't think we use that a whole lot. It's mainly antibodies, monoclonal antibodies, and steroids. That'd be the best. Yeah, and some anticoagulation depending on the design.
I think we had a previous discussion on all the medications used for COVID. We should just forward the link, and I think people should look at it and decide the treatment or talk to their physicians.
So next question, Ravi Sharma Pacharchandi. Can you put some light on magnetic effects on some people after vaccination been found in India? ମୁଁ sure ନାହିଁ ସେ କ'ଣ mean କରୁଛନ୍ତି ଆପଣ ଯଦି ଅଛନ୍ତି meeting ରେ you can unmute yourself and ask the question and clarify.
There was a WhatsApp video we circulated.
Acha.
This is fake. This is fake. Actually, India रे वर्तमान किछि वीडियो वायरल होउची और प्लस मु निजे भी देखिची आफ्टर वैक्सीनेशन within say 25 days to 30 days परे बॉडी रे गोटे मैग्नेटिक वेव बोले गोटे क्रिएट ही होची आपण जदी स्टील हो कि लुहा हो और इवन एनी टिन आपण जदी बॉडी पाखर नउचंती से बॉडी पाखरे पूरा माने रही जाउची लाखी की आपण माने भी सेटा वीडियो वायरल हेइतला you must have seen that.
I don't think so. This is called electromagnetic electrocution. in your body you generate positive waves, because our body generated positive waves. So when you are going to any other clear, if you sometimes you get a electric shock when putting the hand on the switch, or sometimes you get a shock when you're putting on the like computer or any desk, even the wooden. So it is electromagnetic. It's generated by you in your own body. Even the normal people get it.
Yeah, it has nothing to do with the
Yeah.
vaccine. I think
Thank you, Dr.
Nothing to do
Kyle.
with the vaccine.
Yeah.
Thanks for the clarification.
Next question.
Next question. अच्छा, Facebook रे गोटे आछि एबे अभिजीत महांती पचारचंती, is Delta virus more dangerous? My family was infected during first wave and now vaccinated. What is the chance of getting affected by Delta version again?
Radha bhai,
question होची all these alpha beta delta jota भी होची थोड़े infection हेइथिला, so we are supposed to get the antibodies usually कौन हुए body immunity रे दीटा type हुए, either you go for a antibody response or there is some sort of a cell mediated CMI कौन भी तक, तो CMI measurement stage रे करा होनी, तो हिमराल को देखि हमें चाहूँ जे antibody देखि हमें जानू जे हाँ किसी response है कि नहीं. So following first time some काको कौन COVID हेइथिला, तो definitely तांको body रे immunity थिबो humoral or cell mediated. तापर second part से vaccine नहीं चंती, question टा कौन था vaccine नहीं चंती. Can I have the question please?
Sangeeta, can you Sangeeta please? No, can you unmute? Sangeeta, can you unmute please?
Yeah, sorry. So supposing the family was infected during first wave and now vaccinated, what is the chance of getting affected by the Delta version again?
Yeah, question ever hellas first time infected thile, they recovered it. After some time as per recommendation from India, semane vaccination और दुईटा को dose नहीं, तो now vaccination भी नहीं चलती और natural immunity भी. After that जदि Delta infection हो, it will be something unusual जोटा है भी, because vaccine नला परे infection है ची वो जगह रे, but because इतने clearly मना हो चीज़ है vaccine is not going to protect from infection, जो infection है वो vaccine will protect.
Excellent. Thank you. So next question, Sangeeta. I think, yeah, go ahead.
Next question. After taking 2 doses of vaccine, Dr. Satyajit Pandya, after taking 2 doses of vaccine, I got infected after 2 months. I was hospitalized and now cured. I'm taking Eliquis 2.5 milligrams for last 20 days. For how long shall I continue it? And or do I do a D-dimer test again? Question, Dr. Thomas.
Yeah. So this is Amara. He's a physician, right? The one asking the question.
Yeah.
Yes.
Yeah. Okay. So basically, when we start Eliquis, the duration of therapy is at least 3 months. If there was a PE in the lungs, definitely can use it up to 6 months. The question is, after we stop Eliquis, do we do maybe a small dose aspirin? That's a good thing to do. If you finish Eliquis, I would say you can get on aspirin for another 90 days. So you want to kind of protect your blood vessels for at least 6 months. Yeah. And what is the other part of the question?
Should I do a D-dimer test
Do you
again?
need a D-dimer?
No, it's not. I think it's no. As long
Yes,
as you
there's no
have
need.
Eliquis in you, there's no need to do a D-dimer.
No.
Tapare, like at the end of 3 months, there won't be any D-dimer left in you. So like it's all kind of going away. So there's no necessity to do a D-dimer. But the duration is actually 3 months at least, or if there's no concerns for bleeding, you can go up to 6 months. That's if you have PE. Yeah.
So there is no need of.
Yeah. Ask a question. Yeah.
Hello. There is no need of again for D-dimer test.
I mean, if it is actually something you're concerned, I don't say no to my patients. I always say if you're worried about it, you can check it. But the question is, if it is what is the reason for the D-dimer?
आपनको
So
जदि ओवरऑल भलो लागुची सिम्पटम्स
Yeah.
नाही ताहले
Yeah.
किछि नीड नाही राइट
yeah,
So you
I
will
think we have Dr. Panda, we have seen some of the patients. We have they come back after 3 months, 4 months, still their D-dimer level is moderately high, not very high, but moderately high.
Yes.
But
So it was
that does not produce any sign and symptoms. That does not produce any sign and symptoms.
so
And
as
they are,
of-
if they're very well
so-
maintaining their health, so no
Yeah.
point to do it.
so
Yeah,
Dr. Panda, what was your pulse ox during the hospitalization?
After, excuse me, what is your question?
What was your pulse ox, your oxygen levels?
No, oxygen, now the oxygen level is 90.
By the way, let me, Ponda, why don't you come out? He's my batchmate. He's a gynecologist. Satya, put yourself on video. Ah,
Okay.
ah.
Okay, I'm put. Atoshu bhai, hello.
Yes, I can hear, yes.
Put camera on kar. Ah, good.
Okay,
Uh,
I can hear, I can see you now. Yes.
Okay.
yeah, tell us the pulse ox.
Yeah.
Tell us the saturation. How much is your saturation? How much was your saturation that time? Yeah.
That time it was 91, but now since after my I was discharged after 10 days. In the that time it was 98. Since then it is 98.
Good.
Okay, but then they didn't see any pulmonary embolism on the CAT scan.
No.
So technically, you can go for 90 days and you can stop it. But I would say that definitely move on to maybe an aspirin for another 90 days after the Eliquis.
That's right. Yeah, I fully agree with Vijay. So take the Eliquis for 3 months, then switch over to aspirin.
Satyajit, any DVT ho ki clot ho, ala? First is always 3 months. Okay, unprovoked DVT or clots. It's always 3 months. So first 3 months per then you can evaluate. Take that. Generally, it's 3 months, 3 to 6 months. So it should be good.
Next.
D-dimer color, there is no therapeutic benefit.
So there is no benefit. Yes, that is true.
Yeah, there is no therapeutic benefit that creates anxiety. It may be in a
So-
downstream clearance come thiba, you will be holding the D-dimer and getting worried, right? As long as you're taking the treatment, you should not be worried about.
So next question hochi, one of my family member, 36-year lady, is having problem after vaccination. The left side where she took the vaccine is still having severe stiffness and no strength. She's unable to move hand and next even after 49 days. We have shown to doctor also, but we are not getting any help. Dr. Mishra Koive?
Well, we haven't come across such a long-term kind of a sequelae to vaccination. Maximum these kind of symptoms have lasted for not more than a week. So I would ask for a proper investigation of any other thing that might be coincident to this. At least I have not come across such 49 days of vaccine.
Sangeeta, is the person online? Or? I mean,
No, this was on a separate link. Sabya's Facebook post hitila.
Okay.
So Facebook maybe
yeah,
there.
So the question is the arm weak because of a neurological sequence of events that happened?
That is
Injury.
injury. The nerve injury can happen. Yes.
Yeah, and the thing is, the nerve injury, especially when you give it on the shoulder, should not happen that much. But we do see localized mononeuropathy. I've seen that with even flu vaccines. After the flu vaccine.
Jekonosi vaccine rahi pariba, but not
any vaccine can
specific
happen.
with COVID.
So technically, they have to see a neurologist. Yeah.
Yeah, but what is surprising me, after 49 days, he has been visiting doctors, right? So somebody must have given them a diagnosis as to.
Right.
So far, they have not got. So I think they should check with their neurologist also. Right?
Yes,
Neurologist,
yes,
Neurologist, yeah.
Just to be on the safe side.
Yeah.
Next question asks Sri Tilak Mishra Pachachanti. How worried should we be in US for kids less than 12 years old? Or kids ଭାଇ କହିବେ?
Okay, sure. Actually, amaro USA re we are giving vaccine, Pfizer vaccine, 12 ବର୍ଷରୁ 15 ବର୍ଷ 12 and above. Kintu I think Somarendra knows that I think the trial is going on Covaxin. The result is going to come out in I think August, September. So at US re trial chalichi below 12 years old. The Moderna is doing from 6 months to 11 years. Even Pfizer is also doing 6 months to 11 years. That result is going to be out very soon. So I hope by September we will be able to know, and I think they will be started taking the vaccine. Now, question is how much we should be worried. I think we same thing. Amku COVID guidelines, 3 things follow kariya padibo, and means children, usually the infection is milder, but still they have to be careful. They have to wear mask when they come out of the house. So
Atasu, now with this Delta variants, all the variants, they're affecting children more than adults. They have to be extremely careful.
Yeah.
In the full SMS, you don't have to visit, go to places, social distancing, masking, everything. They have to be strictly isolated.
Yeah.
Excellent. So next question.
Next question hochi gotte thila seta repeat jo baricitinib bisare seta we have already covered. Next hela Covaxin in Bhubaneswar, Covishield in other places. If Covaxin is first dose, can Covishield be second dose? Ame already eta kahi sarichu haba katha nuhe. Next ta hochi any idea about using methylene blue inhalation?
Very interesting.
The question is asked by Sabyasachi for the batchmate. Sabyasachi. Sabya, are you there?
Okay.
Sabya, you are
As a treatment for COVID, na kona? COVID, maybe treatment of COVID, whatever. We won't recommend at all. That's
Right.
answer is no. We don't want to get into any controversy.
See, I call it WhatsApp University. These are questions promulgated in WhatsApp, and we are not going to talk about all this. Please listen to scientific data.
Sorry, sir, this is not from WhatsApp. There are lots of literatures. If you search methylene blue in COVID, there are thousands of literatures for treatment and prophylaxis.
Well, we don't use that at all.
Yes,
I have done so many in ICU. I have been involved. I have used methylene blue. Somebody goes to bacterial septic shock, and when we vasopressin everything, I have used methylene blue for that. But no, there is no role of methylene blue at all in our, and there is no proven literature.
Oh yeah, and Sabya knows it. That's why he's asking. Sabya,
Yeah.
can you
No. In India, people in Gujarat, they are doing this and treating, and they are confident. And there are a lot of literature. It is not that it is not there.
Yeah.
There is no literature about it.
No, in Maharashtra also they are using it. Maharashtra.
Well, let me tell you, they have done
and with good result. It is not. They are very confident that this is working.
Well, then
Maybe future will tell us.
No, they should publish the data. They should do randomized
No,
control.
they are doing. They are doing. They
Yeah,
are doing
that's-
that.
I think
Let's
best
wait
would
for
be to submit their findings to ICMR. Let
Yeah.
ICMR vet
It's
all the
early now
findings.
to
and-
tell yes or no. Okay.
Sabyasachi, I mean
Yes.
the basis of that methylene blue is nitric oxide synthesis inhibitor. It inhibits that.
Yes.
So there is more of nitric oxide, and that causes this vasodilatation and maybe oxygenation. But what is exactly the mechanism? It's not yet known. Probably it's going on. The research is going on. The papers may be produced, may be published, say after months or so.
I
From
think
Maharashtra.
methylene blue are using for different purpose. But when you given methylene blue to the body, they were giving the wrong result of saturations. You know that the saturation they always shows 99%.
Yes.
Although
That's
their oxygen level is much lower, but they always shows 99%.
Yeah. We do what we do when I use methylene blue. We don't go by saturation. We go by.
We don't go by saturation. No.
Okay. Anyway, I think we should move to the next question because this is kind of controversial now. Next one, Srikant Sai Facebook Live re pacharchanti, vaccine nela pore family planning kari habo ki? Dr. Mishra.
Sorry, mane vaccine nela pore family planning. Sorry, the use of oral contraceptive.
किछि स्पेसिफाई करना हंदी, so I think सब किछि बोधे मीन करचंदी.
But there is no need for family planning.
I
after
think what they
vaccination.
are trying to say maybe is, can they
Go for
plan for the baby?
Yeah, they can.
Yeah. Yes, correct.
Sangeeta, I would a question Facebook re. Paddevi. Good evening, Arshit Behra. Before 12 days, I tested positive, and for a week I was admitted in hospital and took injectable remdesivir. I was discharged 3 days ago, but now for the last 2 days, often I'm having suffering from mild fever and severe cough. Is it normal so that I'll continue my medication at home, or should I be admitted in the hospital again? Anybody can take the Vijay. You want to take? Matushway, you want to take?
Vijay will take it. Vijay, go ahead.
Yeah. So Devashish, what day is he now? How many days?
Discharged 3 days ago, but now for the last 2 days, I'm having mild fever and cough.
Yeah. So the thing is, any COVID symptoms can last up to 14 days, maybe even longer. So the biggest thing is he has to get his pulse ox checked. He has to do his pulse ox daily and make sure it's always above 95, 96. If the pulse ox has gone down to 92, if it's going down, it's a concern. So most likely he will need, if it's going down, he has to go back to the hospital. If he is staying good, then it's good, but I'm hoping he was discharged with some anticoagulation and some steroids. So he has to get in touch with the doctor to kind of just make sure he's on the right path. But the key thing is to make sure his pulse ox is always above 95, 96.
Exactly. Thank you. I think somebody raised hand. I think 2 people have raised hand.
Rashmi and Mr. Prusti. Rashmi?
Can I go?
Yes.
Yeah.
Okay, so this is a question, like I happen to talk to my auntie. She's like in her, I think late 40s or like just early 50s. So she had a breast cancer and one of her left breast has been removed. So now she's asking like taking the vaccination will have an impact on her because her nerve setup is very low on that side. It's very weak. So just wanted to know, she's very afraid to take the vaccination.
Immunity is low.
Well,
So I
well,
think.
Well, we say for breast cancer patients, we tell them that they should take the vaccine in the other arm, not on the same arm. So that's a recommendation that we suggest. So I think, but if she cannot take in the arms, there's no harm in taking in the thigh muscles also, buttocks.
Okay, good. That's a good thing. Thank you.
Second person ki hand is Kutla.
Does she say taking chemotherapy, Rashmi?
Yeah, she has recovered like 10 years ago. She has been undergoing.
Like 10 years, but she's not taking any
No,
chemotherapy
no.
That's fine then.
Yeah, thank you.
Mr. Prusti, achanti ki se hatha tekithile. Deepak Prusti.
But anyway, so I think we are all disturbed. 2 p.m. So it's already 2 hours. If there no further question.
Devashish, you are echoing.
Mr. Prusti is there. No question.
Everybody.
You are on mute. Mute Raj.
Dr. Ajit, I have a question.
Good minute. Let him finish. Prusti tapre. Mute re acha ke?
No sound. Maybe the phone is recording.
Nico, all of a sudden.
Pusti Babu, you are on mute.
He's not on mute. He's not on mute. He's but I looks like
Something is wrong. Something is wrong.
Okay. I got a question. Achi, Covishield or Covaxin, which one is better?
Both are
We
good.
have discussed so many times this one.
Yeah,
Both
Yeah.
are
yeah.
good. Both are good.
Yeah, both are good.
Take whichever you get first.
Yeah.
Both
Right.
Both
I
are
would
Both are
assume the-
good, but this thing Covishield gives 70% protection the first dose, and Covaxin less. After second dose, Covaxin is around 93%, but Covishield second dose almost 94%, like that. The first dose it gives more. The Covishield 70% protection.
Yes, but in a pandemic situation, any vaccine which gives more than 50-60% protection are comparable.
Yes.
Dr. Ajit, more छोटो दिटा question अछि. I want to speak in Odia also.
Yeah, no, tell me, yeah.
ମୁଁ ପଚାରୁଛି ଆପଣଙ୍କୁ ଆପଣ ଏ ଡେଲ୍ଟା ଭେରିଏଣ୍ଟ ପାଇଁ କିଛି ରିସର୍ଚ୍ଚ ଚାଲିଛି କି ତା ବିଷୟରେ ଆପଣ କିଛି ଅଛି କି ଷ୍ଟାଟିଷ୍ଟିକ୍ସ କିଛି ଦେବେ କି ଆଉ ପ୍ଲସ୍ ଆଉ ମୁଁ କହୁଛି ଆମର କ'ଣ ଆଉ ନେକ୍ସଟ ବୁଷ୍ଟର ଆସିବ କି ମୁଁ ଦିଟା ଡୋଜ୍ ନେଇ ଯାଇଛି ଆଉ କ'ଣ ବୁଷ୍ଟର ଆସିବ କି ଡେଲ୍ଟା ଭେରିଏଣ୍ଟ ପାଇଁ ଆପଣଙ୍କର କିଛି ଷ୍ଟାଟିଷ୍ଟିକ୍ସ ଅଛି ଦେବେ କହିବେ
Statistics, the Delta variant is we have started, the Delta variant is already start spreading in UK, but which does not have much data in UK yet, because the Delta variant and Delta plus still in the very preliminary stage, because we have got only Delta variant is about 16 to 17,000 people are affected, but Delta plus is somewhere about 43 or 45 people has affected. But as far as vaccination is concerned, the Delta variant is quite effective, but the AstraZeneca, Pfizer and Moderna, they're all effective against Delta variant that we have seen. They are quite effective, but in the bit of lower side, but quite effective. But we have not done it at Delta plus yet, because Delta plus, the very limited number, we don't have any data much. So still we are waiting for the data to come.
So are you expecting any booster in near future?
We have not declared it yet, but I'm not supposed to say unless the government say that you do it, but we have not decided yet.
Thank you, sir.
Thank you. Yeah, so the last question for Dr. Ratha, I think. What is the natural course of this COVID virus? How can we give Shraddhanjali to the virus?
Can I have a little clear, because I missed it.
What is the natural course of the virus?
How are you going to finish it?
How are you going to give Shraddhanjali? It means he's dead. Virus is dead.
Okay. I think this is the most multi-million dollar question, looks like. And that's why I think you have put it in last. So, the answer is, to say when it is going to stop, put a full stop, is very difficult to tell. But the natural course of COVID is that just like other respiratory viruses, it usually majority of scenarios we get self-limiting, respiratory borne, and usually after say acute phase is very less time, like 3 to 4 days, and the person is going to get the infection symptomatic. Within 10, what the government recommendation says that by 10 days, usually the person supposed to be declared as non-infectious. Means that the virus, whatever the virus is there, after 10 days, even if you detect the virus in RT-PCR or any other format, it is most likely they are non-living. Usually, unless it has been proved by cell culture system that it has grown and infectious and that way. So after 10 days, usually the WHO says that it is non-infectious. So the natural antibodies usually start by after 5 days, and you are expected to have after 7 days, means after first week, the IgG antibodies, they start appearing. And you can expect a full-blown antibody after 4 weeks. So whenever we test for the antibody after vaccination, usually take 4 weeks time after infection or vaccination, so that we are going to get some indication that whether the antibody is produced or not produced.
Thank you, Ratha sir.
Avansis.
And
The
the
last question.
scenario is that after 10 days, whatever we have lot of questions, I think we have discussed hard before. If a person comes positive after 4 weeks, 6 weeks, and anything, is it that the person is harboring the infection, infectious? As per clinical sense, after 10 days, usually we should think that it is non-infectious. The like virus components may persist for a few weeks, but it is not recommended that we should wait and get worried. So that is a worrisome scenario. So we should be clear in this aspect.
Yes, thank you, Professor Rath. Last question, I think there was another question that just popped in. COVID first wave affected old age, second young age, third children. What is the reason why COVID is affecting stage by stage, Professor Rath?
It is very difficult to assume. It is observation, definitely. So the old age, first phase old age means because of the immunity, the exposure, the first wave, not only old age, the comorbidities were much more affected.
Yeah.
So the immune status of the person and the new virus, that adaptation between these two might have been a scenario projecting that the old age people were affected in first wave, but first wave also some children were also getting, but they were asymptomatic.
Yeah.
And second wave we have seen. Second wave we have seen more with children, but children again the infection disease severity is not so high as with adults, and more so what we have seen with a change scenario of the multi-system involvement, MIS, children variety and other variety. So these are all step by step, and difficult to say that is it really due to adaptation of the virus or evolution of the virus or the decline in immunity of the host. It is a very complex scenario.
I think you are right, Dr. Ratha says. What we have, about 3 months ago, we have discussed this one in our meeting at VK Paul was there and Guleria was there. That do you need immunize the children 12 years to 18 years? They are not infectious. They are infectious, but they're not dying. But we need to save the population first, younger age group. So we should immunize the younger age group first rather than the children's, because children's are affecting. They are getting infection, but they're not dying. They're not getting so much of complication.
Yeah, but then they become the cause for spread in family.
That is the thing. That is the reason the cause for a spread. The spreading can be stopped by mask, vaccine, mask, and or distance, all the things. But we need to save the people first.
But Ajit, if you go by all the new variants from UK to Brazil to South African to now Indian variant, you see they're more virulent, are definitely causing more harm to the children. So not that they're harmless. We have seen one 12-year-old girl here, she lost her leg. She didn't get vaccine. It was in CNN. So yes, it is, compared to adults, maybe less, but why you take the risk? Why you take the risk?
I'm not saying, because in India, we don't have any vaccine. The vaccine availability is much less. You need to save the people with the older age group, 70 to 80 years. You are vaccinated the people. I agree, we can vaccinate the people to everyone. But taken in count, we need to prioritize the people.
Yeah.
That is true, but right now, whatever vaccines are available are 18+ vaccines. By the time a pediatric vaccine below 18 comes, it will be around October, November.
Yeah.
So by the time we are hoping majority of the middle age and senior age would have been vaccinated.
Herd immunity. So very passionate discussion. Mane laguchi jemti program no saru, but our goal is to help out and reach out most people as much as possible. And obviously, ame to pura dunia ro problem solve kari paribuni. Bhagwan hi seta ko help karibe. So I think we are close to wrapping up. Thank you, everybody. Thanks to our panelists. Thanks to Devashish Bhai, everybody, our audience, especially for listening us. Rashmi, I can never forget you. Without you, we could never handle this presentation. If I'm forgetting any names, please pardon me. Devashish Bhai, to you.
Best question of the day was Shraddhanjali question.
That was created by me. Okay, to make it
I
little light.
agree.
Okay.
That is just everybody, that's the right word for what we are doing right
Corona,
now.
yeah.
Exactly. Thank you. And so first of all, I would like to thank all the audience, Sangeeta Koila, for being here and getting educated and knowing awareness. And the most important thing is please follow the advice. And I would thank Professor Ratha from the bottom of my heart for taking his time out from a busy schedule and preparing the slides.
It's such late in night when in India, especially.
We love
Really,
you.
thank you, Professor Rath. Really, I
It
admire.
is nice. It is nice that I came into this platform.
Yeah.
I am getting educated. So it is a free education I am getting.
Yeah, we are bonded now, so we'll be doing bigger things now. We'll plan bigger things. And thanks Ajit Bhai and Samarinder Bhai. I cannot thank you both anymore. You guys are core part, and we are proud to have you as part of our group. Wonderful.
You need to say that next week we are not doing.
Yeah, I will announce that. So
yeah, can you announce that?
I'm doing
And
that.
our ambassador, Arpita,
Yes.
I cannot forget you.
Very
Yeah,
sure.
Arpita, where is she? Yeah.
She's been there from the beginning. Every session she's been here supporting and promoting and reaching out to the masses through her popularity.
Right. Archita and Sabir are integral part of our group, and we thank them a lot. And then all the guests and the wonderful questions also. Wonderful questions posed by everybody. Nanak Bhai.
All the questions were very nice.
Yeah. And nice and relevant. Nice and relevant questions. Very nice questions. Nanak Bhai for gracing the occasion with the prayers always. And Archita, you gave a wonderful prayer today. Thank you so much. Yeah, and Julie and Sangeeta did a wonderful job. We really loved it. The way our ladies handled the moderation, it was a change, right? I mean, guys we were a little bit having a different take. Right? Now,
Never underestimate the ladies.
Exactly.
Never underestimate them.
That's why we wanted to make a change and see what's the difference. Now,
Yeah, Nanak Bhai, right. You were right. Absolutely right.
COVID is going variant way. We have to go variant way.
Yeah, next time we'll have the gamma strain.
Recording bond kar diya to ithra.
We'll stop the recording. If anybody wants to chit chat, then that's fine.
Next time we'll talk about the gamma strain. Yeah.
Okay, bye bye. Good night. Good night.